Could I ask everyone to take a seat, please? We'll go ahead and get this started. Get my sunglasses off. Don't need those in here. All right, ladies and gentlemen, I'd like to call the special meeting of the Destin City Council, April 29, 2020, to order. First up, we have the Pledge of Allegiance. Would you like to lead us, sir? Yes. We're going to start tonight's meeting. We're going to open with public comment. And I just want to remind the folks that are here and the ones that may want to call in or email or the city with any questions or comments that tonight's meeting is to focus on COVID-19 issues. That's what we're here for, and I want your comments and your text messages or emails to reflect the issue at hand, which is COVID-19 and the actions of this council. So what I'll do is we'll start first with the folks that are here that would like to speak, and then I'll get with you, Matt, and look to you, and we'll see if anybody wants to make comments through the web. And I'll just look out there in the audience, just raise your hand, I'll recognize you, and you can come on up. Just, if I could get one of our staff members to turn the microphone on, we'll just keep the microphone on, you don't have to touch it, but just state your name and your address, and then you'll have 3 minutes to make your comments. Bill? You good? Come on
Actually,
up.
Mayor, I have a question. Is there
Yes.
a way we can get this back screen turned on, or is there a technical problem?
I think probably the technical problem is the button wasn't pushed, right? Well, maybe not.
So does that mean if that screen's not on, you can't see me?
Yeah, well, we have to turn around and crane ourselves to look behind us.
You're upside down again, Skip.
Because I call you from my bedroom, I'm actually sleeping here.
We'll wait just a second, see if we can get the screen working. It's coming on.
Thank you.
So we will have to look at Skip after all. Well, that sounds good. All right, Mr. Bill, come on up. State your name, address, take it away.
Bill Reddington, 722 Vintage Circle, Destin, Florida. I would just like to make comment that hopefully y'all are going to vote to open the beaches this evening. For the simple fact that I've watched the meetings in both Walton County, Bay County, and then recently Okaloosa County, where they started out with very limited, but then they decided that after a trial run to open it up dawn to dusk. I mean, I hope that y'all make that same decision, because my thought is that if you limit the beach to a 7 to 9 and a 5 to 7, whatever hours you choose, the masses are be going from 5 to 7 and from whatever, 7 o'clock in the morning till 9. Where if you spread it out, okay, it's not going to be, okay, he wants to go to the beach at 7, he wants to go at 9, he wants to go at 12, so that you won't have that massive congregation there at one time trying to spread out. I happened to be over in Panama City Beach on Sunday, and I actually walked on the beach there, and it's pretty glorious. That's all I have to say. And if you're not going to open the beaches, then I personally believe that you should close Publix, Walmart, Lowe's, Home Depot, because up until the last few days, nobody's been wearing masks, and they're crawling all over each other in there. I feel more unsafe going to the stores than I do going to the beach. So I hope that you would take that into consideration. And once again, I'm hoping that you do the dawn to dusk, and especially even from an enforcement issue from the police if they're going to be monitoring. A lot easier if the crowd's spread out. They're going to be there anyway. Thank you.
Thank you, sir. Next. Raise your hand. Don't be shy. Come on up, sir. Marcy, I'll get you next. I saw you starting to stand up.
Good evening. My name is Ken Frizzell. My wife Doris and I live at 1044 Highway 98 East, otherwise known as Emerald Towers Condominiums. We're permanent residents there. We live in a condo full-time. That's our only property. And first, I'd like to say I do appreciate everything that the council and the city businesses have done to maintain and control the spread of the virus. But I do have some comments. I'll reflect a lot of what the previous man just said. And as a private beach owner, I really have no fight in the public beaches. That's for somebody else to address. But as a private beach owner, where we were actually deeded our property to the water line, I feel that we should be able to utilize that. And appreciate when you do open it, and I hope hopefully that's open very soon, that it's open, like he said, dawn to dusk, because it's easier to enforce. But also, same thing, if you put everybody out there in a 2-hour group in the morning and 2 hours in the afternoon, it is going to be crowded, even though there's minimal people here. Like in our building, we have 82 condominiums. There's 6 people here right now. I know when they open up the rentals, that's going to increase. And if you put everybody out there at one time of day instead of allowing them to go through different times of the day, then it's going to be more crowded. Also, the same thing, going to different places. I like to get out and walk every morning or every afternoon, walk up and down the beach. Can't do that right now. Well, I decided to walk up Highway 98 and cut over on Gulf Shore Drive and walk down through that subdivision. On a 5-foot wide sidewalk, I met 27 people in a short span of time, walking 3 feet shoulder to shoulder. That's open. Why is that open? You know, it's much more dangerous, though. The beach is the safest place you can possibly be. All the doctors are saying that the half-life of the coronavirus on the beach is like 2 minutes. So even if somebody does cough, you know, it can die pretty easily, quickly. But I think we should, of course, still maintain social distancing. I think that's important between groups. I would myself like to see the vendors come back, and the reason for that, they could kind of self-police who's there. Those vendors, the beach share vendors, know the owners. They have an owner's roster who's supposed to be there. They can only rent to the owners if you want to do that as a first step, and then open it up to renters later on as they come on board. So that's my comments and my thoughts on the matter, and I appreciate your time and listening to me. Thank you.
Thank you, sir. Marcy, you're up next.
Good evening, Marcy Bell, 3 Gulf Breeze Court here in Destin. I just had a couple of statements that I wanted to make. First of all, I'm not opposed or in favor of opening the beaches. I leave that choice and decision up to those of you sitting here. With that being said, the only things that I would like to bring to point is the governor spoke before we came to the meeting tonight. The bars are still closed. The restaurants are only allowed to be open 25% inside, and outside is supposed to maintain the 10-foot distance. I can't remember what the 6-foot. Thank you. So with that being said, that goes to my next concern of short-term rentals. I'm not opposed to them. I'm not in favor of them. Just a simple comment that I'm a little concerned about the sanitizing of those units and how that will be handled when those short-term rentals are reopened. Back to the beaches. Access points that we have, specifically the public access points, are so narrow. Once again, the gentleman before me spoke about the distance when you're walking down paths and such. So where's that in the safe social distancing? And my biggest concern that I've posted a lot about on my blog is the people that come in from out of town and their I'm on vacation mentality, and how that will affect us when it comes to shopping and things like that. We already know that while they were here, they wiped us out in our grocery stores of everything that they could take back with them. So I would actually hope that maybe there would be a resolution for hours for the locals to shop before the rest of the crowds, kind of like the elderly did that you guys had worked on. So we are able to shop for the items that we need for our families. Thank you.
Thank you, Marcy. Does anyone else like to, that's here, make any comments? Go ahead, Mr. Broom.
My name's Tim Broom, and I live at 211 Snapper Drive. And, you know, one of the things that I would like to bring up about the beach opening, you know, is for myself, I would really like to see the beaches open, you know, 24/7. But I think it's also good to work partnerships with our other counties, within our own county and our adjacent counties. You know, it's going to be very difficult. You know, we need to explain to our visitors that are coming down here, what are the rules? If Destin is one thing and the county is another, and Walton is one thing and Santa Rosa is another, it's going to be very difficult. And I would encourage all of our leader groups to somehow, over the next week or 10 days, before we get to this next phase, to somehow work together to see if we can get all of this to be the same. Otherwise, it's going to be very, you know, we field a lot of, you know, I don't know if y'all know me, I run half-inch tackle here in town. We field a tremendous amount of calls from our visitor base. And having things be so different is very difficult to tell our guests. And it's, you know, and we rely so heavily on them, you know, do we want them to come? When do we want them to come? But we rely heavily on them. And being able to give them some accurate information is going to be real important to us. So that's what I wanted to let y'all know. Thank you.
Thank you, Mr. Broom. Anyone else that's physically present want to weigh in? Seeing none at this time, I'll look to Matt. Do you have anybody online there that has raised their hand?
We do. Lisa Remkes. Lisa, if you can hear us, you can unmute yourself. Just push the little microphone button. She stepped away.
Next.
There she goes.
Hi, are you there?
Yes, go ahead, Lisa.
Hi, thank you. I'm coming from St. Louis, Missouri, and we've got a vacation here planned to come in on May 16th to a facility called Shoreline Towers, right there in the heart of Destin, I'm assuming. So we've been coming for 20 years, and it's real important for me to find out, like the gentleman before, accurate information. We've already canceled our airline. We're going to take precautions driving, but I feel as though the same isolation that we here have been doing is going to be performed down there in our condo with the 5 people that I'm coming with. We're going to be isolated in the condo. We possibly could go on a fishing excursion, just depending on the regulations on that. But at the same distance, the beach that we go to is real small, 1 row of people, limited hours for us. We couldn't come. We're not going to drive 11 hours. We're isolated here in St. Louis and all over the country. And we would come down there and be isolated in our condos and only have to go to the beach, which is what we look forward to. We'd like to be able to, you know, spend our money and provide to these vendors that are there local and give them our fair share of our, you know, our payments and our, you know, our revenue, and to increase them and help them out. That's just what we look forward to. I mean, right now it's kind of pending, though. We're all on standby. So I don't know if I got to cancel and, you know, we look forward to it in September, or if September's not going to be a good month, or if maybe next year in 2021. I do hope that you guys do consider opening the beaches. I understand that it may be the limited hours at the beginning, but, you know, maybe in the next 10 days or so, you consider opening up them fully. I've listened to Okaloosa's commissioners, and it sounds like that's what's going to happen with theirs. I know they have a meeting on Tuesday, but just kind of hearing from them is maybe what you guys will follow as well, just to be in the county's standpoint. Nonetheless, though, I hope you guys open. I understand the safety that you guys are taking for the visitors as well as the community there. I appreciate you listening to me, though, and I hope to see y'all soon.
Thank you, Lisa. Appreciate your comments. Matt, do we have anyone else?
There's no one else.
All right. Seeing no one else, Ray, did you have any questions or emails?
I have a couple, Mayor.
Go ahead, sir.
First one is from Ms. Sam Perman. It's a question. In considering the reopening of beaches and businesses, what is the city's plan for testing for the coronavirus?
Who wants to take that one? City manager? I guess that would be, it's directed towards us.
We would let the Okaloosa County Health Department take the lead on that. They have a facility about at the Walton County, Okaloosa County border right now, open 2 days a week. According to what the governor said before our meeting, if the demand increases, then he would see fit to increase our ability to provide additional tests.
Okay, so we'll get further answers during our briefing that's coming up next. Ray, do you have another one?
This one is from Sean Christian, General Manager of Hobby Lobby. If the governor does not extend or alter his safer at home executive order, will business such as Hobby Lobby be able to reopen on Friday, May 1st? Does the city have any plans to enact their own restrictions or limitations on businesses reopening?
City manager, I'll let you answer that one again.
I don't believe that our governor's executive order actually told them that they could not be open. So I think perhaps on a corporate level they decided to close their stores. So I don't know how else to address that particular question.
Yeah, and this council had, the only thing I believe that we did as a council was close the beaches. The short-term rental ban, all that other was actions taken by Governor DeSantis. So that's why we're here today to discuss reopening the beaches, because that's in our privy of actions to do. So is that all you have, Ray? So at this point...
Mayor, we do have some additional...
Okay, go ahead, Matt.
We have Tammy, I believe it's Preus, and I'm going to go ahead.
Okay, Tammy, when you come on, just state your name and your address, please.
Okay, can you hear me?
Yes, we can.
Okay. Actually, I live in Tulsa, Oklahoma, and we actually have a couple of fractionals at the Emerald Grand and planning on coming again May 15th-ish, and definitely won't be coming if the beaches aren't open, because that's a long way for us to come as well, and would appreciate if they do open those as well. And I'm kind of with the other lady from out of town, is I just wanted to speak my piece too. So I'm listening in on this to determine if we're going to make a travel to come along and spend all the money and, you know, getting there, and I can sit at home, you know, on my porch. So, but I'd rather be there on the beach.
We appreciate that, Tammy. We'd rather you be on the beach as well.
So, anyway, all right. I just wanted to speak my piece too. Thanks.
All right, thank you, Tammy. Matt, do you have anyone else?
We have Anne Marie Diaz.
Andrea, can you go ahead?
Yes, sir. Thank you. As a local, I just want to know, how would we regulate all the people and guests that are visiting the beaches or the parks in a 6-foot social distance? What if I sit down with my family and then another family sits like 2 feet away? Who's supposed to regulate that? Is law enforcement supposed to? I mean, that's going to overwhelm them. How do we still keep everybody safe in the city of Destin, but still abide by all, you know, the social distancing?
Captain Nix, you're on the hot seat. And I think I know what you're going to say, but say it anyways.
Yes, sir. As we all know, it's a recommendation. It's not enforceable, so we just hope that people will abide by what's being told to them as far as the recommendations goes. And we've had pretty good luck so far.
Great.
Thank you, Mr.
Thank you.
All right, thank you. It's about being good neighbors, and hopefully, when you do come and visit us, that the other folks that are here visiting, or locals themselves, will be a good neighbor to you and your family when you come here, and vice versa. All right.
We've got Stephen Keffner.
Go ahead, Stephen.
Can you hear me now? Okay. I
Yes.
live at 930 Gulf Shore Drive, Shoreline Gardens, and I agreed with the gentleman talking about coordinating with the county. And the only other aspect I see that wasn't mentioned, if the county public beaches have limited hours and we have people on our destined beaches, will we run into the issue of people trying to get into complexes and maybe just, visiting people, flooding our beaches to where it could become less manageable? That's the only other aspect that I had that wasn't mentioned.
Thank you, Stephen.
That's all.
All right. Anything else, Ray? Tim? We don't have that many folks here, so and I think the council wants to hear from everybody, even if it's round two.
Yep, so Tim Broom again, 211 Snapper Drive. Just wanted to add one thing for y'all to, maybe that y'all can clarify. But one of the gentlemen asked if Hobby Lobby could open it. As part of the governor's statement today, retail businesses, retail businesses could open at 25% capacity. So the answer to his question would be yes. But the one thing that the governor didn't discuss today was if he was going to let the short-term rentals expire on the 30th, and just wondering if y'all can address that. Do you think it's going to happen? What's going to be happening there? Because he did not address that.
All right, I'll let our land use attorney, Kim Kopp.
So as of now, if he does not extend the executive order tomorrow, it would expire and they would be able to be back in operation on Friday.
Thank you.
Thank you, Mr. Broom. Matt, do you have anyone else queued up? All right.
No one else.
Bill would like, come on up. I set a precedence now, so come on up for round two.
I just wanted to mention that Okaloosa County beaches are opening on the 1st with those limited hours, but then on the 9th, they're opening up dawn to dusk. So that's already put into play. They're using that week, my understanding, just to make sure that it was not going to be out of control, in so many words, so that they're coming back the 9th or before the 9th to change it if it is turning into an issue. And I'll also just mention when I was on Panama City Beach on Sunday, people were very respectful. I didn't see anybody sitting 2 feet from each other. They were like that far away. I mean, the wall over there. And even when people were crossing on the beach, because I was walking on the beach, you picked a side and you shifted that way and the other guy shifted that way, so there was plenty of distance between. People were extremely polite and wanting to do the social distancing.
Yeah, and I just want to, and Mr. Bowman, you can correct me, the county voted to develop a resolution that they're going to vote on next Tuesday that will open their beaches full-time on the 9th. It is not, they have not made that decision and voted on that and taken action. Is that correct, Mr. Bowman?
That's correct, Mayor.
Okay, I just want to make sure we were clear on that. All right. Any other comments? Ray? None? Well, at this time, I'm going to go ahead and close the public comment period. We'll make a public comment available again at the end after our two briefings and then the actions of the council. So first up, Dr. Karen Chapman is here to give us our first briefing. Dr. Chapman, you've got the floor. Hold on one second, Dr. Chapman. Mr. Braden?
Thanks. I just want to make it clear why it's still fresh on everybody's mind after those questions. I believe that, when we do open up temporarily or for so many hours in the morning and so many hours at night, if people don't continue to keep the social distancing and it gets out of hand, then, even for our people that are coming to vacation here on the beach, if it gets out of hand, we as a council will probably be forced just to call another meeting, special meeting, and just shut it down altogether, for another 2, 3, 4 weeks, whatever it may be. So I just caution everybody to, don't just run to Destin, get up on the beach and crowd it, because, if that happens, then we will be forced just to shut it down altogether.
Thank you. Thank you, Mr. Braden. Dr. Chapman, do you hear me? You have the floor now.
Can you hear me, sir? And
Yes.
Can you see me or not?
Yep, we can see you and hear
Okay.
you loud and clear.
All right, thank you, sir. So I just wanted to sort of give you a little bit of an update on where we're at. I did listen to the governor, and I understand that we are moving to what is in the Opening America Again plan to phase 1 on May 4th. Just to give you a sort of a little background, so what has happened since the last time I saw you all. I think we were very fortunate in the actions taken early in our community that we did not get overwhelmed. We are over 154 cases, and one of the things your health department has done very diligently during that period of time is extensive contact tracing. And while most people haven't talked about contact tracing prior to just recently, it is something we do on a routine basis. But I think our ability to jump on and get all these cases investigated and isolate contacts, quarantine contacts, isolate cases, has helped us keep our numbers down, and our hospitals have not been severely impacted. A couple of things that we do in our through the health department is many years ago we installed an electronic biosurveillance system in all of our hospitals. The hospitals agreed, and no personal information is in there on individuals, but the chief complaints for all visits are entered into this system. And so some of you know that we monitor influenza-like illness every influenza season. We are now monitoring something called COVID-like illness, and have been since the first part of January. The daily percent of ED visits that we look at are those that mention cough, fever, and shortness of breath. Our level of whether or not we have reached 14 days without the with a lowering and an ongoing lowering of the symptoms is at a stage of what is called indeterminate. And it is at an indeterminate stage because our level of people coming to the emergency room with symptoms of shortness of breath, which is a particular symptom of this illness, is still in about the 6% range. And you may say, well, that 6% doesn't sound like much, but this is way above where we were last year this time and 2 years ago this time. So it is of concern, but we're just one county out of many, and the combination of all the counties, the governor certainly has made the decision today to move forward May 4th with this phased approach. I would also like to sort of address the issue of testing that one of the speakers spoke to or asked a question about. So to let you know that through April 25th, 2,125 tests have been done in Okaloosa County. Now, if you look at that, really the vast majority of those occurred in the month of April. In March, it was hard to get testing supplies, and we only did community-wide about 4 tests a day. About 122 tests were performed in Okaloosa County during that time. But we've now gone to many more tests per day. Your health department alone has done approximately 33 tests per day, including symptomatic individuals in our community, as well as symptomatic healthcare workers and asymptomatic residents and staff of long-term care facilities. We also have been very fortunate that White Wilson Medical Center has been willing to provide primary care services and medical evaluation to people with respiratory symptoms. This has been a very short supply of physicians willing to see patients who need medical evaluation. White Wilson has been able to ramp up to about 30 tests per day in the month of April. And Eglin Air Force Base is also a major provider of this service, and they, on average, are doing about 11 tests per day. So if you look at that, we're probably doing about 71 tests per day, and that's averaging over 7 days a week. According to recent guidance, and you did hear the governor talk today about the need for increased testing. We do have a need for increased testing in Okaloosa County. The state is estimated to need to be able to do almost 16,000 tests a day. We're not too far away from that. We are doing about 10,000 tests per day. In order for us to, in Okaloosa, we need to really ramp up from our about 70, 71 tests a day to 151 tests per day. So that will be a major effort on the part of the health department and the medical community through next month to ramp up testing. So supplies, the swabs and different type of testing supplies, as well as personal protective equipment, have become much more readily available, particularly in the last half of April. So what my concerns are moving forward as we turn up this dimmer switch, which is the example I gave to the county commissioner, because it's a whole lot easier to flip the switch off. And in March, when we took that drastic move, we were in the midst of spring break and spiking cases, and really the need to reduce the number of people was just critical for us to get on top of this situation. Now we're reopening, and we're reopening in a phased approach. What is of concern to me is the governor has reduced our capacity to serve our communities, for particularly the restaurants and retail, to 25% of capacity. I think it's a right move. But it is, and also that there will be no movie theaters and no change for bars and gyms and personal services like hairdressers, which I know many of us are very anxious to return to. My concern is for our vulnerable population as visitors start to return. And I do believe people have really, many people are much more respectful of the social distancing concept after about 6 to 7 weeks of implementation. But as we increase the number of visitors coming into the community with the opening of the beaches and the potential opening of the long-term rentals, I thought the long-term rental situation was tied to the state of emergency for the state. So I'll leave that to Mr. Maddox to address. But I am concerned about our vulnerable population, and that would be people over 65 and people who have serious chronic medical conditions. I was concerned hearing that our facilities will become a little bit more crowded, and particularly our grocery stores. And I think the young woman, Marcy, mentioned that concern about the grocery stores. We were pretty wiped out in our grocery stores by mid-March, and we're only just recovering in the last couple of weeks, in that you can go into a store and there's actually toilet paper on the shelves. So I do have concerns for, and I agree with Marcy, for our residents, but particularly our vulnerable residents and their ability, especially those who are living in the community. And there are many vulnerable residents living in the community, and our ability to protect them so that they can go get food at grocery stores. And they can continue. We are recommending, the governor is recommending that they continue to do social distancing and staying safer at home. But they do need to go out to medical appointments, and they need to go out and get food. So what can we as a community do to protect our vulnerable residents? And that is an issue that I think is really important for us not to forget, because this is the group that has generally poor outcomes. I do want to just reemphasize, though, that it's not just vulnerable individuals who are at risk for poor outcomes. 25% of people who are hospitalized for this disease have no underlying conditions, and that's pretty unusual. So just don't want us to forget that. And then again, just the issue around the policing of the social distancing, where we are still in a mode of 10 or under in our community. So I guess that's where I'm at right now. I don't think this has ever been about closing the beaches, although I will comment to the statement that the beaches, while they are outside, there is no protection in close gatherings just because you're outside. There was talk about that somehow that UV light would kill this virus. The only UV light that comes from our sun that penetrates our atmosphere is UVA and UVB, which burns our skin, or if you're lucky enough, it tans it. The UV light that kills viruses is called UVC, and it doesn't penetrate the atmosphere. However, it is manufactured and it is used to kill viruses and bacteria in hospitals and laboratories. Unfortunately, that is a very dangerous form of UV light, and it actually burns eye tissue and other tissues, so human beings cannot be exposed to that. So I don't want people to think that we can utilize our beaches and disregard social distancing or feel safe because we're out in the sunshine. Obviously, being outside is better than indoors, but I think it is important that we continue that messaging of being respectful of people's spaces and how we both access and leave the beach and respect each other as we move forward. And I'll answer any questions if you have any. Thank you.
Okay, we do have a few questions. Dr. Chapman, up first is Ms. Ramswell.
Thank you, Mayor, and thank you, Dr. Chapman. We really appreciate you speaking with us again. I did have a few questions, and the first one was that you noticed that, you actually said that y'all were doing some testing of asymptomatic workers at healthcare facilities, and I was wondering what the results of those have been. What is the percentage of asymptomatic folks that have been tested who actually end up testing positive?
Well, I don't really have huge numbers, but what I can tell you is we have found asymptomatic workers working in long-term care facilities. The numbers are small, but the testing numbers are small also. That is why I really feel very strongly that we need to expand testing and offer more testing, particularly to asymptomatic healthcare workers and first responders. Since I last spoke to you, we now recognize that people are shedding this virus from 1 to 3 days before they actually become sick. And in fact, there is pretty high viral shedding during those periods. that is why it's really important that we slowly reopen, so that we can see what happens when people start intermingling a little bit more, even at reduced capacity. It is why it is recommended that people wear face masks when they're going to be in situations where social distancing is not completely possible, and or to protect themselves, like when going to the grocery store or shopping in retail centers. So what is the percentage of asymptomatic testing? I don't have that for you here tonight, but I can tell you that in our healthcare workers, asymptomatic healthcare workers are definitely a risk to our community. And in the last 2.5 weeks, I diagnosed more healthcare workers than we have in the first half of this pandemic in our community. And pretty much all of them have been working during their asymptomatic high viral shedding period. And we've had large contact investigations because of that.
Right, right. So building on your comments, how long does the virus actually live inside the body and would be caught through testing? You say we shed it fairly quickly, so how long after we've shed it might an individual still test positive?
Yeah, that's one we're still learning a lot about. We are finding that it varies based on individual. So some people, maybe within a week, will test negative, or will not have any more symptoms and test negative. But we've had people who are out 21 days that are still shedding virus, and we haven't been able to release them from isolation.
So what I'm getting at here is, what is the likelihood of folks who are asymptomatic and being tested and ultimately testing positive? What's the likelihood that maybe they had a sinus infection or a cold, a very minor case of this days earlier, but by the time they're actually tested, they didn't know they had anything. So when they're tested, they're positive, but they don't think they've had anything, and what they had was just a sinus infection or something.
Right. Yeah, we're finding over time that there's a broader range of symptoms for this virus than just cough, fever, and shortness of breath. We've broadened our testing to typical upper respiratory tract infection symptoms, sore throat. We've broadened it to nausea and vomiting because there have been some reports of that. We've broadened it to anybody who reports to us a sense of a loss of taste or smell. This is becoming a prominent symptom of that. We have many people with mild symptoms. In fact, what really sort of shed the light on this, the shedding of this and the sharing of how mild these symptoms can be was a report recently by the CDC of a person who had very, very mild illness, more like a cold, not so sick that he couldn't attend a family birthday party and a family funeral. And that usual gathering of family members, not in the same household, but family members, ultimately resulted in 15 people becoming infected between the funeral and the birthday party, and 2 people died as a result. We've had circumstances with choir practices where even with practicing social distancing, a choir group out in Washington State of about 40, 28 became sick, 22 were diagnosed with COVID-19, and 2 died. So we call those kind of family gatherings, the reunions, the birthdays, the funerals, the choir groups, sort of these super spreader events that can result in multiple people getting ill. So that is something to be concerned about.
So there is this fear out there of folks who are asymptomatic running around and infecting everyone else because essentially they're asymptomatic. But it sounds as if the truth might be they could be symptomatic, but it's so mild that they've either discounted it, thrown it out the window, or it's already past the time they had something when they're tested. Is that accurate?
Well, I think it's accurate to say that there are some people with absolutely no symptoms. We have people, we've had residents in long-term care who are positive with absolutely no symptoms. And individuals who are positive with no symptoms have no idea that they're shedding this virus. They have no idea. And then we have people with relatively mild symptoms. People who say, I had a headache and I'm a little achy and a sore throat, or so mild that they feel like it's their hay fever. So it's nobody's fault. It's just the way this virus is. And that's why the social distancing is so important. And that's why as we reopen, we need to do this slowly so that we can see the impact of people coming together again. And how will this virus rear its head, or can we manage this with incremental steps like we are moving into with phase 1 on May 4th?
Thank you, and I'll drop that line right now. But my next question is that you were talking about the need to go ahead and continue ramping up the testing. And my question in that regard is, if we suddenly start really ramping up our testing, then obviously we're going to be getting some more positives come back. Wouldn't that artificially elevate the rate of incidence and cause essentially a panic, if you will, when in all actuality the numbers of actual infected might really be the same or even lower in regard and in reference to the rest of the population?
Well, actually, what we're seeing is as we increase the number of tests, testing people, we actually are seeing our positivity rate go down. So I don't think increasing, but I think what it would help us do is identify individuals who are at risk of spreading, and that's why we need to offer access to more testing. In fact, in long-term care centers, we are recommending what's called surveillance testing. So every 7 to 10 days, everybody in the facility should be getting tested, because there is such a risk to transmission from those who don't know they have it. So yes, there has to be more testing, because if we can identify individuals with the virus, we can rapidly isolate them, identify their contacts, quarantine their contacts, and try to put a ring around this virus and not let it shed further. Otherwise, if we just keep passing it to each other without those efforts, without finding cases and isolating them and finding their contacts, it could get worse.
Thank you. And then my last question is, last week we had our council meeting and I mentioned the fact that if you take a look at the number of folks who live in Okaloosa County, and then you take the number of folks that have been diagnosed positive, it really comes out to only 0.06 of the population of Okaloosa County, which is a very, very, very small number. And that's not taking anything away from that 0.06 that has suffered and those that have passed away from it. But comparatively, 0.06 of our population is very, very small. Can you comment on that?
Actually, we represent about 0.97% of the population in Florida. We represent about 0.46% of all the cases. And I credit that to the fact that we intervened quickly as the number of cases started to ramp up. So if we hadn't done what we had done in March, if we hadn't ramped up and we hadn't started all the testing and finding cases, this is the benefit of contact tracing, something we have been doing from the beginning. We were able to get on top of it, to find cases, to isolate them, to quarantine their contacts, to monitor their contacts for 14 days. We have had a number of contacts become cases. And so then those people then go into isolation. So we've been able to get on top of this. So it's, I think, not having it explode in our county is not a bad thing, but we shouldn't say that it means it's insignificant in our community.
Absolutely, I agree with that 100%, and that's one reason we all acted as strongly as we did, was to prevent the spread. So, you know, in that regard, thank goodness our rates are so low, and here in Okaloosa, 0.06, and throughout the state, I believe you said 0.9. So thank you, and in part that's due to your speaking with us and the data you and Captain Maddox brought forward. So thank you for that, and thank you for answering my questions.
You're welcome, ma'am.
Thank you, Ms. Ramswell.
Mr. Mayor?
Skip, go ahead.
Yeah, if I could just expand on Dr. Ramswell's question about the expanded testing, if we're going to ramp up the testing. If we do ramp up the testing, who would we actually test then? Because I know I see a lot of counties now that are actually offering these kind of drive-by testing or walk-in testing, and it sounds like they're not even having to be qualified to take the test. They just walk in and show up and say, I want to test, which would probably be prudent, I guess, if from what you're saying, if there's a lot of people walking around that don't have any symptoms, but they're still asymptomatic, which that would probably be a concern. But how are we going to ramp ours up? And if we do ramp it up, who are we going to be testing?
So in the last day or so, the CDC has broadened significantly the people that they would say we can test. They're also recommending what's called surveillance testing, and that means we would test a whole group of people. So, for example, a group that we really need to do testing on is healthcare workers, not just symptomatic healthcare workers, but asymptomatic healthcare workers. And so we want to be able to have enough capacity to tell healthcare workers, why don't you come in and get a test? Let's see where you're at. And hopefully then be able to identify some of these asymptomatic and immediately circle around them, isolate them, identify all their contacts, quarantine their contacts, and then monitor those contacts and try to put a wall around the transmission of this virus by every case that we find. That's what helped us keep our numbers low in this county over the past 6 to 7 weeks. And that's what we need to continue to be able to do as we move into this phase 1 reopening. But in order to really do that effectively, we've got to have more testing capacity. I am working on that. It is difficult to go from about 71 tests to 150 tests a day, and not so much today as worried about getting the supplies to perform the sampling, and nor is there as much concern about the ability to get access to laboratories. Besides our state public health lab, we worked with extensively with Quest, LabCorp. All have been able to ramp up their lab capacities in the past 45 to 60 days. I mean, it's extraordinary. We're in a much different place than we were in the middle of March. We now have generally very, very good access to personal protective equipment for healthcare workers. We still can't get isolation gowns, but we can get face masks, we can get N95 masks, we can get gloves. We're in a very different place today than we were 45 days ago. Now it's taking those phase steps to see where we go. And increasing testing is one of the hallmarks of the governor's phase 1 reopening. And we've all been tasked as county health departments to come up with a plan. I hope to be able to work with my partners, White Wilson and I, which spoke this morning about what capacities they might be able to do, and they're looking into that. We're looking at expanding our partners with the community paramedicine program offered through Okaloosa County. So we're looking at a variety of options. I'm looking at expanding my own capacity, trying to double what we do per day at the Okaloosa County Health Department. So pulling together those bits and pieces. It would be great if we had another provider in town who would want to help with this. But right now, generally it's the hospital EDs, emergency rooms have really, actually the most interesting thing that has happened is that generally our emergency departments have about 2,600 to 2,700 visits a week. It's down in the about 1,500 range per week. From April of this year to April of last year, there's been a large decline in the number of people seeking emergency room care during this pandemic. And that is of great concern in that we hope that people who do need emergency services, like suffering a stroke or a heart attack, will go to the emergency room. And that's been concerned. But they obviously have not been a major avenue for testing because people haven't been going to the emergency room. So hope that answers some of your questions.
Thank you so much. And thank you for all the hard work. I know you and everyone in your department is really largely responsible for the reason that we're in the good condition that we're in right now. So thank you very much.
Thank you, Mr. Overdeer. Mr. Menschel, do you have any questions or comments? Go ahead, sir.
Yes, I do. Thank you, Mayor. Doc, first of all, again, thank you so much. I've, I guess, had the pleasure or I've been informed by you. Almost every speech you've given, I've been able to listen to, and I've learned a lot. And I thank you for that. One of the things that I listened to you tonight, and I hope everybody listened out there, is your information. You told everybody about the sun doesn't kill the virus. You know, there's been all kinds of rumors out there, get out to the beach and the sun's going to help that. Well, you just cleared up that rumor. You said early on, you know, we only get a chance to do this right the first time, and I think we have. So again, thank you to your staff. Looking at my notes, I had a couple of questions that I had for you, but one thing I would say that I got a phone call from two different managers of properties, and they told me they obviously we've been inundated with emails and phone calls about close the beach, don't close the beach, and I thought this was interesting, building on what Ms. Bell said about not having supplies. One of these property managers told me, they said, when we start having renters here and the turnover, we can't purchase proper sanitization supplies. Okay, so that's just, it's just a you know, from a commercial wholesaler or anything else, they can't even buy that. So again, that's just something to keep, because it's certainly going to be well above just cleaning. It's going to be sanitizing. So that's just an issue. Bravo to you for the contact tracing, because you've been talking contact tracing from the first time you started talking. And I think we're light years ahead of everybody. So again, thank you for that. From the standpoint of plans, my first question, 14 days from now, give or take, if everything opens up next week, would we look for a spike if there's going to be a spike in approximately two weeks, give or take?
We'll look at the data. So we tend to look at the data in 2-week chunks. So when things start to change May 4th and we start moving into this next phase, we'll then look at the next 2 weeks. But we really have to look at it at the end of those 2 weeks, because we can't look at it day by day. You need to look at it in total across a 2-week time frame. So that's something that I don't think I explained very clearly at the beginning, is when we talk about a 14-day period, we're not looking at day by day by day. We're looking at it historically in a 14-day period. So our data, is, I tend to try to look at the what's called COVID-like illness data, because we don't have, we've been fortunate not to be overwhelmed with cases and overwhelmed with people in the hospital. And, that was the whole point. We didn't want to get overwhelmed with them. So as we reopen, I actually probably would expect to see a little bit of an uptick. That's going to be natural from the fact of the social interactions that will happen when we're in our restaurants or our businesses. Again, that's why having access to testing and making sure people can get tested. Maybe they're like, I don't know, I was around somebody that was coughing and I feel kind of uncomfortable. I'm not sick, but but that person seemed kind of sick. Can I get a test? I want to be in a place where we can say, yeah, you can get a test. Because then if that person is positive, then we put that ring around them, put them into isolation, find their contacts, and try to wall off the virus at that point in time. So that's the benefit of, so maybe there might be a little uptick, but it also allows us to rapidly swoop in and do our contact trace and isolation and quarantine to wall off the virus.
Okay. My next question, thank you. My next question is from the standpoint of the build on the testing. For the benefit of everybody out there listening and whatnot, how would a person right now, what's the procedure, the protocol? How would they come to you to get a test?
Okay. So we have a telephone line, and I should have pulled that up before I got on the. So we have a telephone line that it's 850-344-0566. It is our COVID-19 public information line. And while we're not there yet for being able to open up for asymptomatic people, right now, if you're symptomatic, you will get switched over to our medical screeners, and they will talk to you about your symptoms, and we will schedule you to come to our COVID-19 testing clinic. Now, so who we tend to focus on at our health department COVID-19 testing clinic are those people who do not feel sick enough that they feel like a doctor should be evaluating them. But if they are sick enough and they feel like a doctor needs to evaluate them, then we would refer them to White Wilson Medical Clinic. And then they would call them and they would get scheduled for an appointment there. And that is how we would triage people, depending on their personal needs for medical attention and or testing.
Okay, I appreciate it. Thank you very much, Doctor. That's all, Mayor.
Thank you, sir. Thank you, Dr. Chapman. Seeing no further folks queued up here, we're going to go ahead and move on to our next presenter. Mr. Maddox, would you like to take the floor, please? Hit the button.
How about that? There we go. Good evening, Mr. Mayor, City Council. Very nice to see you again. So Dr. Chapman stole a lot of my thunder, but that's okay. She's very good at what she does, and she presented a lot of information for us. If with your permission, I'd like to address some of the lingering questions that you had out there from the audience.
Absolutely.
Okay, great.
I think that's what everybody that's watching online and that came, they just want some answers to the questions.
Sure, and then I have some data to present to you as well as some steps forward. One of the questions we get a lot is, why did we choose to have limited hours on the beach? And that's an excellent question. And some of the logic coming on the other side of that is certainly if we funnel more people down into a smaller time frame, there's going to be more people within that time frame. However, what the thought was, and it was echoed by the governor today in his speech, was that we were trying to limit out-of-town people from coming to our beaches, traveling from hotspots, or actually coming from areas that did not do as well as Northwest Florida did. Because we did outstandingly well because of people like Dr. Chapman, because of people like you, because of people like our board who did things early, took the right steps early, and we did very well for ourselves and other communities that were not as fortunate. If we open wide open right away and we don't give ourselves a chance to go ahead and make sure that we're going to do things the right way, we could import a tremendous amount of heartache for ourselves if we left it wide open. It may not be worth it to travel here for 2 hours in the morning or 3 hours in the morning, but for a 12-hour day on the beach, that's worth the travel to me. I might drive somewhere for that myself. So that was some of the logic behind it. I know it doesn't make sense to everybody, but that was the thought that we put into it to try to give ourselves an opportunity to make sure that we were turning the volume up slowly and making sense out of the decisions we made. Also, as far as trying to make the hours the same, that was an excellent question as far as trying to have some coordination between Santa Rosa County, Okaloosa County, Escambia County, Walton County. And when I created our demobilization unit, one of the things that my administrators did, County Administrator Coffey and Deputy County Administrator, County Administrator Hofstad and Deputy County Administrator Coffey, was they were having conversations with not only you and your team, but with the county administrators of the surrounding counties to try to say, can we all get on the same page? And as you can imagine, with different city councils involved, with different boards of county commissioners involved, it's not as easy to do that as it would seem. There were a lot of individual decisions, that's a tremendous amount of opinions to kind of funnel down into, hey, let's all do this because it makes sense. Because different things make sense to different boards, of course, for different reasons. So although we did make an attempt very early, and some of those conversations changed very quickly, we were not able to come to consensus early, meaning at some time last week, that we could all do the same things at the same time. Sometimes that's a function of geography. Sometimes that's a function of, like our county, not only having Okaloosa County beaches and Destin beaches, but areas where we have Eglin Air Force Base controlled beaches. And then there's many minds that go into those decisions. So unfortunately, we weren't able to coordinate all at once, but those efforts are still underway. So, we do what we can with what we've got, and when, if there is no consensus greatly over an entire wide region like that, then we make the best decisions we can locally. And to one of the points that Dr. Chapman made, it's a great idea to hope that one day we could have 207,000 test kits available for Okaloosa County, and that would be a great way to find out who all was exposed to the virus, or rapid antibody testing to say, we were exposed at one time. We could not be positive today, walk out the door, touch a door handle, scratch your face, and be positive tomorrow. So that test kit, that gives you a snapshot in time for that moment and the moments before it that you either had contracted the virus or not. So that's one of those things that's always going to be a variable until those tests are available in the quantity that it can be done over and over and over again. Then that would allow you to see those on a more consistent basis. But no matter what, one of the things that we can see on a consistent basis is how many people are in the hospital seeking treatment for these symptoms. So no matter how many people get tested, we can still see that back-end result of how many people are sick enough to seek treatment. And that's something that we monitor daily. That doesn't help us with who is asymptomatic and spreading it, but it does give us a goal. And the goal is to protect the elderly and the vulnerable populations no matter how many people have been tested, because that's always going to be a goal in a response to this fight. Protect the elderly. The long-term care facilities have to be well supplied. There has to be stringent guidelines on who can and cannot enter those facilities, and protect those with underlying health conditions. And that is an all-hands-on-deck call to everybody in the community, that we all have to be responsible as these measures get demobilized a bit, that these are things we need to do to protect each other. And if we want to enjoy the things that we're able to enjoy now coming up, then we all have to participate in that. So I think it's a call to everybody in the community that, okay, we're going to get things going again, but let's be responsible, and let's make sure we protect those who are the most vulnerable to the disease. So just to bring those out there real quick. I can go through very quickly. Right before I came here today, the governor gave his press conference, and I typed down as much as I could in the limited time I had before I had to leave the county and come on over here. Many folks have already hit on a lot of those points, but some things that we didn't get right out are some of the important goals and methods that the governor used. Number one, he used these words: small, deliberate, methodical, and data-driven. So those are things we have to consider when moving forward, and these are the things that the state is considering when we're looking at implementing these different measures and demobilization tactics. Small, deliberate, methodical, and data-driven. And of course, it's to start Monday, and it will exclude Miami, Dade, and Palm Beach counties, because Southeast Florida right now is still experiencing significant challenges, and they are a bit disproportionate to the rest of the state. And of course, he specifically mentioned Northwest Florida as doing very, very well. Some of the goals, of course: protect the elderly and the vulnerable, make certain that hospitals are supplied and have capacity. We need an economic recovery. Protect individual rights and civil liberties. That was a big one. I heard a lot of people in my office cheering for that one. Increased testing, absolutely, Doc Chapman hit on that, and we, as well as the emergency medical services, are attempting to get into that game as well. The supply chain is moving much more rapidly than it was even a couple of weeks ago. The test kits are beginning to flow. FDEM is pushing them out rapidly. We're beginning to receive them. So as we receive more test kits, and they won't be taking away from critical needs in the hospitals, we can expand some drive-through testing sites, which we're beginning the planning phases of now, and should happen rapidly, I'm hoping. And I'm going to be contributing some personnel personally to that. So, prevent the introduction of virus from outside the state. I'm going to say that again. Prevent the introduction of the virus from outside the state, because we've had some call-in questions regarding that. I'd like to do this and that from out of the state. And part of the governor's goal is to prevent the introduction of the virus from outside the state. So some of the measures we're taking, not that we want to treat our tourists any differently, but at this early phase in beginning to get our feet under us again, we have to be very cautious about importing folks that may have been exposed to this in areas that weren't as well controlled as Florida was, or Northwest Florida was in particular. Fact versus fear. Early predictions for Florida. Florida was going to be worse than New York. That's what we were hearing. Didn't happen. Florida was going to be worse than Italy. That didn't happen either. By April 24th, Florida would have 465,000 hospitalized due to COVID-19. In reality, it was about 2,111. Florida would run out of ICU beds by April 14th. We still have 36.5% of those available, and that no ventilators would be available, and we have 76% available, as well as 6,300 still sitting unused. So that was some of the early predictions that here's what's coming to you. One of the things I spoke about in my board meeting on Tuesday was, how did we get to where we are today? What made us take these protective measures? And these were some of the things we were hearing. This is what's going to happen. Our biostatisticians were lighting up our emails saying, this is what's coming, and you have to prepare, and it's going to be bad. And we were very, very fortunate to take action early and to prevent that from happening. But this is what we saw. This is what we were faced with. The state gating criteria. Per the governor, ready for phase 1, cough trends dropping, ILI dropping, that's influenza-like illness, cases declining. The last 14 days, the spikes that we were seeing were due to backlog data dumps, and what happens with that is some days the data won't be reported for a day or two afterwards, and then you get an overwhelming amount of data in one day, and of course for that date it spikes. Last 2 weeks positives for Florida were between 4.5% and 6%, with the statewide average being somewhere in the 9 range. Crisis care, we have excellent capacity, more than on March 1st when it was ramping up heavily. So that's where we're at with that. The fight to protect lives centers on the long-term care facilities. Dr. Chapman is very big on that, and the state has sent incident management teams to the different regions to assist with those things, as well as screening the staff, testing. Florida Department of Emergency Management has done direct PPE pushes to these facilities without having to go through any of the county staging areas where they may be doled out to other critical needs. These have gone directly to the long-term care facilities and nursing homes, which is a fantastic idea, and Director Moskowitz did a great job with that. Walk-up testing sites in some underserved areas were happening in other counties. The state is supporting additional drive-through tests. Escambia is going to have one. Testing sites, that's going to be state-supported. And of course, those that the governor mentioned would be for years 18 and over, the symptomatic healthcare workers and first responders, and folks who think they have been exposed, which is one of the things that Dr. Chapman alluded to, that is now allowed by CDC guidance, is that folks who think they may have been exposed, where in the past you had to have either a travel nexus or symptoms. That's being expanded now so that we can get some of that asymptomatic testing going. The state actually procured a mobile lab in an RV, which will have a 1-hour test capability, and they intend to have that driven to long-term care facilities capable of processing 3,500 tests per week, which would be great. So if they have an outbreak, they can actually bring this thing out there and just focus on that and try to contain the outbreak, and they can rapidly do the high throughput tests through there and contain that very, very quickly, which is wonderful. In phase 1, which is where we're going to be Monday, schools will continue distance learning. Long-term care facilities, nursing homes, still no visitors. Protect the vulnerable at this stage. Elective surgeries can resume, but the hospitals They must provide their own PPE in regard to that and must maintain surge capacity. So yes, you can still have more folks in your beds, but you have to keep an eye on it to make sure that if while we're turning up these demobilization measures a little bit, if we did have a spike, we still have to be able to handle it. Restaurants, I think one of our other speakers alluded to this. We can allow outdoor seating with 6-foot social distancing and indoor capacity at 25%, still with social distancing. Movie theaters remain closed. Retail open at 25% capacity with social distancing. And bars, gyms, and personal services, which I believe they cited hair salons and things like that, still remain closed. The vulnerable population, specifically identified as 65 and over, those with underlying health conditions, should avoid close contact with people outside the home. CDC guidelines of 10 or less for social gatherings would still be in place. And there was recommendation for face masks in public, but no fines for refusal, and was specifically requested to be practiced by open businesses. And then there were some next steps to get to phase 2, and there were only 3 listed as far as monitoring hospital capacity and resources, monitoring COVID test positivity rate, and monitoring syndromic trends. So the reason that we look for the COVID positivity rate is, like we were talking about, the more tests you do, the more positives you may have. However, what is the % positive in relation to the total number, which is more telling. And moving on from that, I'll actually get to where we are. So this data was pulled earlier today, and DOH is only pushing out the data once daily now. So there would not be an evening update on the numbers, so they should still be accurate. We're at 153 cases, which is 0.46 of the cases statewide, when you do the math on that, and 0.07 of our county population, 0.07%. Now you'll notice that on those dashboards, you'll see the number 24 in hospitalizations, and that number will continue to grow. We won't see that number drop because it's a cumulative number. When you look at the ACA ESS database, today there were 3 persons currently in hospital being treated for COVID-19. None of them were in ICU beds, which is about 0.05% of the hospitalizations statewide if you use the cumulative data, and 0.001 of our county population. At this point, we still have 3 deaths. I do expect that to change as we have many cases in the long-term care facilities. I expect that number will change, and it's unfortunate. But that is 1.9% of our cases and 0.24% of deaths statewide, 0.001% of our county population. There are 27 cases in long-term care facilities, including residents and staff, and that was broken down to 17 residents, 10 staff. About 0.8% of the statewide total. Since I can't say that if all of the staff from these long-term care facilities live in Okaloosa County, the 17 positive residents comprise about 0.008% of the county population. To look at long-term care cases statewide for perspective, I know Doc C didn't have the percentage of how many I think, Madam Ranswell, I think you asked that question of how many, the percentage that we tested negative.
Symptomatic.
Of the asymptomatic. So what I do have is that for the long-term care facilities statewide, 1,140 residents out of 147,416 statewide were positive. That's about 0.8%. And 1,074 staff out of 194,800 statewide were positive. That's about 0.6%.
And that was of asymptomatic testing?
That was just of tests that were conducted for long-term care facility residents and staff.
Regardless of whether they were showing symptoms?
Correct.
Okay, thanks.
Correct. That was the only number the state was able to come up with, so I grabbed it.
No, gotcha, I appreciate it.
Florida total cases, including non-residents, 33,193. Our average is 6.1% positive, which is below the 8.8% state average right now. Okaloosa County has less than 1% of the positive cases in Florida, closer to 0.46, and about 0.8 of the cases in long-term care facilities. ILI and syndromic data are generally declining, but like Doc said, the cough-associated admissions are indeterminate because they kind of go up, they go down a little bit. And that number was right at about 7%, which I believe she correlated to being higher than some previous years. But that 7% was right about where we were in January as well. So we had gone through probably the worst part of where we were with the cough data, and we're back at about right where we started in January. But again, that is higher than the previous 2 years, but just to give you a reference as to where we were. As far as hospitals are concerned, which is one of the questions I also get quite a bit, Okaloosa still has over 30% available bed capacity without counting surge capacity. That's just regular beds. There are only 3 beds occupied due to COVID-19, none of them in the ICU, and that does change daily. If we have somebody who worsens, you will take up an ICU bed, or we might have some more folks come in tomorrow. We have over 70 ventilators available just between North Okaloosa, Twin Cities, and Fort Walton Medical Center. Each hospital has more than 20 days of N95s currently in stock at current burn rates. Some are more than double that. I saw one in the 70s. And they are being replenished, which is more important because several weeks ago we were looking at those numbers going, my goodness, how are we going to go ahead and backfill these folks? And we were pulling from other orders to go ahead and work with the hospitals. But at this point, the N95s are moving, so we're happy with that. As we begin moving toward the reopening procedures and/or the phased demobilization, it's important to recognize that although we're gaining ground, the fight is not over. It is a process, and we have to make sure that we don't throw caution to the wind and just go out, run around willy-nilly. It's not something we should be doing. We should be looking to each other and saying, remember where we were when we started. Remember all this fear, and now we have a grasp on it. So let's look at this responsibly. So when we turn the volume back up slowly, and I believe that's what we intend to do, we have to do it responsibly. And that's echoed by not only Doc C, but by the mayor, by the president. So we have to be very, very careful. Don't throw caution to the wind. I believe that people are a bit more aware now than they were prior to this, or for those that didn't think it would make a big impact. And I think that I hope that we will see people act responsibly when they get out on the beaches again. And that's all I have for the update portion. I'd be willing to entertain any questions you may have.
All right,
Mr.
council
Mayor?
members. Go ahead, Mr. Overdue. Was that?
Thank you, Mr. Mayor. And Mr. Maddox, thank you so much for that's very informative. And so I have a question, and I talked to Commissioner Boyles at one of the meetings we were at with him today and asked him kind of the question. So I'm kind of having a hard time wrapping my head around this idea that we're going to, if we follow the county's guidance on what they're doing with their beaches, we would open up our beaches for a few hours in the morning and a few hours in the evening this Friday, and then turn around the following Saturday and then open wide open dawn to dusk. So it sounds like what we're doing then is we are delaying basically the inevitable, which the inevitable is all the tourists are going to start coming here because the beaches are open, and it doesn't look like the governor is going to extend the short-term rental closure. So they'll be open to come down here. So aren't we just delaying this for 1 week, and how significant is it for us to delay it 1 week?
I would hesitate to comment only because at this point the resolution has not been signed. It is in draft phase, so it has not been brought back to the board to actually have a signature on that. So unfortunately at this moment, until there's ink on that paper, I wouldn't be able to comment to it. It could very well change direction based on what the governor said today. Those conversations have not happened yet. That's very, very new. As a matter of fact, I was typing running out the door as I came to you today to speak. With all of that new information, I think it would be prudent before I comment on that to allow my board to have a chance to discuss that, sir.
Okay, but they are going to open the beaches on Friday regardless, and then we'll not meet again until Tuesday.
For the limited hours, yes, sir. That's what's been signed so far.
So, but I mean, so if, I know that everybody hates to deal in hypotheticals, but if they follow what they said they were going to do, where's the value of delaying this a week between the limited opening in the full opening?
It's a very good question, and I believe that the value will need to be weighed very heavily against the new information from the governor. And again, I do not speak for my board and the decisions that they make. So they voted on that as a body after reviewing all of the information they had before them. And I'm just not able to comment on what they thought at the time that was the value that it had. I'm sorry, sir.
Okay, thank you. And again, thank you to all that you and your department does. You and folks like you and everybody at the county are the reason that we are in the favorable position that we're in now. I'm just trying to make sure that we do the right thing. So thank you very much.
Yes, sir. Thank you for the kind words.
Yeah, Mr. Oberdeer's trying to get you in hot water is what it was all boiled down to. I do have a couple folks queued up here. We'll start with Mr. Morgan. You have a question?
Yeah, it's not so much a question, but just while you're here, based on our decision tonight on opening the beaches for 2 hours during the morning, 2 hours during the afternoon, like Okaloosa County, I think it's important to realize that Destin and Okaloosa County's beaches are very different in terms of the public versus private nature. And we've been spending all year dealing with the inadequacies of our public beach accesses. And across from our restaurant at Camille's, we have a 50-foot wide beach access that every single short-term rental that is not on the beach uses that 50-foot wide beach access. And so I think opening the beaches for 2 hours during the day and in the evening, one, it's going to create a bottleneck for our incredibly inadequate beach accesses, and it's going to funnel people in, which will defeat the purpose of social distancing. And then two, on May 5th or May 9th, when Okaloosa County has a resolution that they're drafting now to open without restrictions, what I'm concerned about is with the short-term rental ban lifted, and I'm not sure the status of Henderson Beach, but with our inadequate beach accesses, those 50-foot swaths of public beach that we have that are surrounded by acres and acres of private beach, I think it's going to be impossible to socially distance.
Yeah, and I think
it's just something we're going to have to think about.
Yeah,
it's going to be a problem.
And after Mr. Maddox is done and we start our discussion amongst us, I think, you've kind of kicked it off, actually. So what we'll do is, Ms. Kopp, I know that you would like to add something here. Don't go away, Mr. Maddox, in case one of our other council members would like to ask you a question. Go ahead, Ken.
Yeah, I just wanted to update the council because, as you know, things do change rapidly, but Governor DeSantis did just issue Executive Order 20-111, which did extend vacation rental suspensions until at least Monday the 4th now. So that was just different than what I told you a few minutes ago, but he did just sign that, and he also extended the executive order dealing with essential services.
Yes, and I believe that is to 1201 on the 4th.
Yes, same day, May 4th.
Yeah. Okay. We have Mr. Maddox here. Does anyone have any further questions? Seeing none, thank you, sir. Appreciate it. I made a joke the other day that you're like Sergeant Friday. Just the facts, sir. Just the facts. Thank you so much. All right. And now it's our turn. Mr. Morgan, you kind of started the discussion off right off the bat. So what we'll do is, do we want to start with a motion and then have discussion, or which is normal Robert's Rule of Order, or would we rather just to have a few comments first and then I'll entertain a motion at that point? All right, well, let's let everybody have a crack at it, and then I'll entertain a motion and we'll make a ruling. Go ahead, sir.
Sure. I think, to keep this in perspective, and I'm speaking kind of anecdotally, but, my grandmother and the nanny of my children, they're both terrified to go in public right now. And they're part of that vulnerable population that we need to protect. And on the same token, we have, and this is just an estimation, but I think 50% of our town is unemployed. I laid off 30 employees on March 19th, and I did it quickly when they closed down our dining rooms so that they could hurry up and file for unemployment. And I keep in touch with those people on a daily basis for the most part, and not one of them have received an unemployment check from the state of Florida. And it's not a stimulus, it's not an entitlement. This is money that, as an employer, I pay on their behalf to the unemployment insurance program of the state of Florida. And it's insurance, and I've been paying tens of thousands of dollars into that program every year. And it's for situations like this. I've never made an unemployment claim in 7 years, and not a single employee has gotten a check. And there is and we have these food pantry lines that Parker's organized, and we've done a wonderful job with them, and I'm proud of our community for putting them together. But those lines are terrifyingly large. And so I'm inclined to listen to doctors and not argue with them. But there is a public health crisis when we have food pantry lines in our town that are a mile long. And it's a public health crisis. There is a degree of public health to employees that couldn't afford a $400 emergency during the good times 3 to 6 months ago. And going 6 weeks without a paycheck and extending that to 12, that's making desperate people even more desperate. And there's a lot of those folks in our town, and a lot of them work for me, and hopefully will work for me again in the future. So I think, the question has been, are we ready to reopen this town to tourism? And, there's not going to be, we can say this is going to be a slow reopen, but I don't think it will be. I think tourists will return to Destin en masse. And the question is, are we going to be prepared for them? And I think tonight we're probably going to vote to open the beaches. And, my biggest concerns is what I touched on when Mr. Maddox was up here was, our public beach accesses. When we lift the restrictions and allow people to be stationary on the beach and allow vendors to operate and people to sunbathe, we do not have enough public beach to service all of the short-term rentals and maintain social distancing protocols. We might, just judging from the beach accesses I see during the summer, I don't think we do. So I don't know the answer to that. And I think when you have a big part of your population is terrified, and rightfully so. I mean, it's scary stuff, and there has been a lot of fear around this. And then the other half of your population is unemployed and completely desperate, and they're standing in line for 3 hours to get free groceries. That's also terrible. So there's not, it's an incredibly difficult decision, and I don't think it's one of those where there is a clear-cut right answer, and I appreciate everybody's input, but it's a tough decision, and we can reopen the beaches and things can go really well, and we can reopen the beaches and things could not go well, because the lady from St. Louis who called in earlier who wants to come down here, there is a much higher rate of the virus in St. Louis, and she's coming. We're opening up our beaches, and she's going to come down here, and that does put our residents at more risk. But you have to weigh those risks. And the other issue that we're going to have, and Mr. Broom brought it up, is this is the list of our counties in the Panhandle and their different restrictions, and they're all, it makes my head hurt reading it. So I'm going to spare y'all of that, but Bay County, Escambia County, Gulf County, Okaloosa, Destin, because I don't know if we're going to adopt Okaloosa Islands policies, Santa Rosa County, Navarre Beach, Walton County, Wakulla, and Franklin, they all have different times, different regulations, and I think it's indicative of this kind of piecemeal strategy that we've employed to shutting down our local economies and reopening them that's going to create some problems. So, I would urge us to, if we reopen the beaches, to do it without time restrictions, only because of our public beach accesses. We don't want to create a bottleneck and defeat the purpose of social distancing.
Thank you, Mr. Morgan. Up next, I've got Mr. Marler. After that, Mr. Braden.
Thank you, Mayor. I don't know how to explain this really, the way I've been writing things and talking about this to other people. What we have is a way that has paralyzed this entire nation. I'm not saying that it's not warranted. I mean, I know there is a danger in this virus. But when is enough enough? When do we stop the fear? And I know Chatham will love this. One of our great Democratic presidents, Mr. Franklin D. Roosevelt, said in one of his inaugural speeches, "We have nothing to fear but fear itself." We have to decide when enough is enough. In this particular instance, in Destin, our economy is based upon tourism. I wish it wasn't, but it is. Right now, you have locals who are out of jobs, as Mr. Morgan stated earlier, and we don't know what's going to happen. I'm on furlough. I work for one of the resorts in this town, and we're on furlough because we have no business because everything's been shut down. Don't know when, and now it's going to be at least a few more days because we're in the short-term rental business, as well as most of this town is. A few more days before that might change. The biggest thing I have is, and it was brought up earlier by one of our citizens, about the tourists being the problem. Our locals are just as much of a problem. If they can't even follow, we have some locals that didn't even follow the same rules that they were asking us to follow. If you were privy to driving over the bridge on Saturday and looked at Crab Island, looked at the frustration at Noriega Point that our poor code enforcement and sheriff's department were trying to take care of. If our own local people can't follow it, how do we blame the tourism business for doing the same thing? We can't. We have to look at a point where enough is enough. The economy in this town is based upon that tourism, and we have to do something. However, I'm in favor of opening the beaches full blast, pretty much like Walton County, because the other uniqueness in that is that we are unique in that versus the rest of Okaloosa County beaches, except for the one they have at Wayside Park. If we restrict our beaches and Walton County doesn't restrict theirs, they're going to go to Walton County. We're still going to lose. We need the people to come back here. There is no easy solution. What this virus has done, it's not just our nation, of course, it's other nations that have done this. There's been rumors and speculations of how this started and whether we're looking at God, New World Order, or whatever that started this whole thing. I said earlier before we had a meeting, I said, I wonder what they did during the bubonic plague, because I don't know what they did in the 15th and 16th century when they had similar things like this. We have the history of what happened in the early 20th century of the virus that was there then. I guess the biggest thing I say is, again, when do we stop fearing? When do we start doing? When do we start saying enough is enough? And for now, I guess that's about all I can say.
Thank you, Mr. Marler. Ms. Ramswell.
Thank you, Mayor.
I'm sorry. I keep getting the first and next boogered up.
That's fine. I'll wait.
Rodney, go ahead.
I could see where you were headed.
I just wanted I had one question, but I did want to say that Mr. Morgan did have a lot of great points, and I agree with what he said. But I have been asked questions, and you can answer this one. How long would it take for a restaurant like Harbor Docks to restock and be able to be up and running 100% again?
We never closed like Parker did, like Dewey's did, and the mayor's did. So we've got it's going to be a little quicker for us, but the dining rooms, I guess, opened May 4th, and the governor just issued the order about an hour before this meeting. And generally we make our schedules on Tuesdays for the following week to give our employees notice. So, I would think probably a week of solid preparation. But for me, we've got Cinco de Mayo coming up on the 5th. And so we're not going to be prepared for that. So we won't, I'm not going to open by the 4th for my dining room.
Yeah, and
You may answer it even better, because I've a lot of the restaurants had, they either sold or gave away a lot of their perishables.
yes,
So
and
I know they
another
can't restock
problem.
overnight.
Yeah, and another problem, Mr. Braden, is you got to get your people back. You got to hire them back, and the ones you can't get back is you're going to have to try to hire new people and train them. I can't speak for Parker because I don't know how many of his folks are going to come back to him. So you have those challenges, and it gets as simple as getting your chefs back. So even though the governor did open it up and everybody's been on pins and needles to reopen, I think what you're going to see across the board is a slow reopening over a course of probably 12 to 14 days before everybody gets back online. So it's that will kind of hinder things as well. So it's fortunately for Mr. Morgan, they've had a skeleton crew and operational, but operations like all 5 of my son's restaurants, we just started. They just got their PPP money today. So we haven't. So now it's scramble time. My oldest son got his PPP money last Friday, so he's got a couple chefs, 2 chefs and a sous chef and a manager back online. So it's going to be scramble time. But I think you're going to see that in that industry. It's going to be a progression. I don't think everybody's going to be ready to open on the 4th of May. Ms. Ramswell?
Thank you. As I noted at our last meeting, we talked a little bit about the beach and do we open full-time? Do we open partially? And I was opposed to the limited hours because, think about it, when you hear limited, it almost strikes this urgent need to go do something. So I felt as if we opened for a limited number of hours, you're going to have everybody cramming themselves in and having a crowd during those hours, whatever number of a crowd we have. Now, if we were open all day, the same number of people that would be coming and cramming themselves on the beach for 2 or 3 hours in the morning or 2 or 3 hours in the afternoon, now that same crowd is going to be dispersed throughout the day, which benefits us. That's what we want. We want to see people more dispersed. There was a comment made earlier about people were behaving well, and I believe it was you, sir. People were behaving well and being very polite, and I've seen that as well. And it's almost like you don't want to walk too close to anyone, and everyone's kind of apologizing when they accidentally turn an aisle and run. But it's wonderful to see, but I'm not so sure how that is going to play out once everyone returns. We're going to have to be more cognizant. But, what that boils down to is responsibility, personal responsibility, which we've also talked about. And as Captain Nix mentioned earlier, he was talking about the 6-foot rule, and someone else mentioned the masks and the fact that it's essentially a rule. It's not a law. It's a recommendation. We can't enforce that. They can't enforce that. No one's going to be arrested for not staying within 6 feet or away further than 6 feet, we hope. And so, again, that comes back to personal responsibility, and it puts the onus on us to make responsible decisions as well. Not just for us and what we want, but what is in the best interest? What is the most responsible solution that we can come up with for this city? We hear about Okaloosa and they're opening their beaches and such, but I don't really know many people that come here to go to a beach that's in unincorporated Okaloosa County. It's Destin beaches that are advertised. It's Destin beaches that are on the pamphlets and on the commercials. So it's really, when we open tourism back up and everyone starts coming, it's the Destin beaches that are the #1 location and tourist destination. So, we really have to weigh heavily what is going to be the right decision here. And for me, again, aside from responsibility, I go back to the fact that we have all the power in the world to come right back up here and say, whoa, this has gotten out of hand too fast. We need to back up. And so with that being said, I am in favor of opening our beaches dawn to dusk. And let's see how it plays out. If we need to make changes, we've got another meeting on the 4th. We've got, another meeting on the 18th. We can schedule one as needed to address the situation. But I think that is what is going to be in the best interest of our community. And I really wish, not that I'm saying let's open all the restaurants up, but, I'm not quite sure where the line falls in terms of our authority regarding what we could open, what we couldn't open. I know, for example, he said no gyms. Well, does that also mean, what extent does it mean some sort of like a cheerleading club or something? I mean, or do they specifically mean a gym where you're going in and you're lifting? You know what I mean? I mean, that's sort of digging in the weeds a little bit. But, there are nuances and loopholes and things that I wish there was some way for us, and maybe there is, to consider some of the things we could look at possibly reopening that wouldn't pose a significant danger, but again, it would put the responsibility on the folks, and it would allow us and our folks that are struggling right now to get back to some closer sense of normalcy. So that's my thoughts.
Thank you. I want to give our at-large council members who are self-distancing themselves an opportunity to speak. I still have a couple people
Mr. Mayor?
up. So, Mr. Overdeer.
I'll just echo what I said when I was talking to Mr. Maddox, and that is, I don't know what we gain. I know we want to get our beaches reopened, and I'm convinced that we are going to reopen our beaches on Friday. But I don't know what we gain by not opening them up fully and waiting until a week later to actually open them up fully. What have we gained during that week? And I hear what the mayor and what Chatham are saying about it's going to take a week, 10 days, 2 weeks for the restaurants to get fully up. And even though they're only going to be able to operate at 25% inside and whatever they can do outside. But so I guess when the tourists come down here, they're going to have to eat wherever they can eat. And they may wind up, my fear would be that they would then wind up going to all the grocery stores and wiping them out and cooking in their condos. But, to get people back to work, I think is one of the key things that we've got to start looking at now, because like we've been saying, these people have been out of work. Many of them have not been able to get unemployment. Many of them have not been able to get by. Even when they were employed, they had a hard time getting by and paying their rent. And now with no job and no unemployment, they're definitely not. They're really struggling. So I'm in favor of us opening up the beaches. I'd be in favor of us just opening them up from dawn to dusk, and let's see. It's going to be the same thing no matter whether we wait another week to do it or whether we do it this Friday.
Thank you, Mr. Overdeer. Mr. Menschel, would you like to weigh in, please?
Yes, sir, I would. First of all, we have a week based on what our land use attorney just told us, that no short-term rental people are going to, it's still closed. Now, there are short-term rentals that are up and running right now. I walk past houses that are occupied, so be it. But we still have a week. If we look at the governor, what he said, small steps, in theory that makes sense, but I agree with most of our council, okay? It makes no sense to do it for just a short time as opposed to opening it up full time. And let me go back into police mode. Think about James Lee Park, which is certainly county property. Do you think the county is going to go to, they've got barricades closing that park down. It's going to require them to go out there twice a day and take the barricades down, put the barricades back up. After the morning session's over with, what happens if there's cars parked in the parking lot? Are they going to tow them? Of course not. Is the sheriff's office going to run out there and pull everybody off the beach? It's just so unrealistic not to go ahead and open up the thing, because let's go back to reality. If we only open it for a couple of hours a day, again, is the sheriff's office going to go out there and run people off? Or the lifeguards going to do it? It just makes a lot more sense. Even though the governor said small steps, I think as Chatham said, we're in a unique position. Okay, our beach accesses are different than other places. And we also have a week where, in theory, tourists aren't going to be here. So we have a week to let our folks get out there, and hopefully, as Dr. Ramswell and others have said, hopefully they won't rush the beach, spread it out a little bit and whatnot. Okay, so again, I'm in support of open it full time. I do want to say one thing. I would just, regarding something that Mr. Marla said, I don't necessarily think, in my opinion, that we blamed any tourists for anything. When we first decided, when everybody decided to close the beaches, what we were doing is looking at hot spots. Unfortunately, New Orleans, Atlanta, places like that were skyrocketing again. So it wasn't necessarily trying to target an individual. It was the hot areas that we were trying to prevent. And as everybody said tonight, what we say tonight, probably by the time we get out of the meeting, something's going to change. This is a fluid situation, and I think it's in everybody's best interest to go ahead and open up the beaches full time.
Thank you, Mr. Mitchell. Mr. Braden, I see you queued up there. Go ahead.
Yeah, Mayor, I want to go ahead and make a motion to, that we open our beaches up from dawn to dusk, effective May 1.
Second.
Second.
Okay, I got a motion. I got a second. Mr. Morgan?
Yeah, what's the status of Henderson Park? Are they open? Are they closed?
Webb, you got the...
Will Henderson Park fall under our ordinance?
I did reach out to them today, and they are hoping to find something out tomorrow from a state park perspective and management. So I will relay any information I get. But they are currently closed until further notice.
And there wasn't a date certain, like the short-term rentals expiring?
No, there's no date certain.
And are they linked to the rest of the park system in the state?
I would hate to speak for the park system, but I
mean,
believe regionally they are closed.
Okay. Yeah, and that's going to be another problem, because that's our biggest point of public beach access that would actually take pressure off of our small beach accesses. And just to kind of illustrate the absurdity of what we're talking about tonight with closing our beaches, you know, let's just put ourselves in this situation where the governor lifts the short-term rental ban on May 4th and we didn't open our beaches. The confusion and chaos that would ensue. If you could rent short-term rentals in Destin but you couldn't access the beach, I mean, good luck. I think you'd all quit your jobs, because I would want nothing to do with the city. It doesn't make sense. And what also doesn't make sense is this piecemeal system of every municipality from Panacea to Pensacola are operating under different hours and restrictions. So I think I'll support the ordinance, but I would caution city council and the city staff to keep an eye on our public beach accesses. And if they get overcrowded like they do every year in the summer, I think we're going to need to meet. If we have 500 people in a 50-foot beach access, I think it's something we're going to have to address. So,
Mr.
Mayor?
Yes, yeah, Steve, I'll get to you if just a second.
Yes, okay. Yes, sir.
No, go ahead. Mr. Destin waived his next in line. Go ahead, sir.
I'm sorry, I don't have the benefit of seeing, unfortunately.
Yeah, no problem.
Something, obviously, nobody that was there, Mr. Maddox and Dr. Chapman, obviously doesn't speak for the county, but it looks like we're going to obviously do something moving forward. I would ask the city manager to possibly contact Eglin as well and kind of coordinate with them and let them know what we're doing, because, again, like Chatham said, we need to try to get on the same sheet of music.
Yeah, I appreciate that, Mr. Mitchell. And I just want to add to Mr. Morgan, when the county shut down public beaches only, this council took a bolder action and had no problem shutting down private and public beaches. And even though we always want to be good partners with our county counterparts, I think that this council is probably going to reserve its right to do what they think is best for Destin. Mr. Destin.
Thank you, Mayor. No, I'm no fan of the piecemeal way that this is all going about, because it creates a lot of confusion in the eyes of the public. Are we creating an issue for law enforcement by bucking what the county's going to do? I'll lean on Captain Nix if he has any idea. To what extent, logistically, does that create issues for you to enforce two separate sets of beach rules within one county?
why he gets paid the big bucks.
I think it's going to create, as in like the last meeting, I asked if we could possibly mirror what the county was doing. Dr. Ramswell said that they could mirror what you guys decide to do. I think either way it's going to create confusion for a little bit, but it's like I told the mayor the last meeting, I think this community has done an outstanding job following the rules, so hopefully they will continue to do that.
And this isn't to make your job harder with what I'm suggesting, opening up the beaches completely. It's just our public versus private beach is so much different than Okaloosa Island.
It's extremely
so we have
different with the
challenges.
limited amount of beaches that Destin actually has compared to the private beaches. That in itself creates so much confusion for people that come here. It creates a tremendous amount of work for law enforcement to educate those that come into town. So we will deal with it like we always do.
Ms. Ramswell, and then I'm sorry. Yes, Ms. Ramswell, and then Mr. Marler.
Okay, thank you. So probably the best way to address this would be in another motion, but we do need to consider by saying opening the beaches fully, do we mean sunbathing, biking, swimming, paddle boarding? Do we mean everything? Do we mean vendors? What exactly are we saying?
Ms. Ramswell, I think this is a good time for me to jump in, because I would ask you guys to look at Resolution 2020-09, particularly Section 2, and the 3 paragraphs that are contained in Section 2. What we really need is some particular direction on how you would like us to modify that language. So if, Rodney, if you were the one that made the motion, if you could describe particularly how you would like us to modify that language, I think that would be very helpful for us as we move forward.
Put this on the public record. Could you go ahead and read those 3 paragraphs?
Sure thing. Paragraph 1 states, except as otherwise described herein, public and private beaches, beach access ways, trails, parking areas solely for accessing public and private beaches, and city beachfront parks, collectively heretofore referred to as, quote, the beaches, are reopened between the hours of 6:30 a.m. and 9 a.m. and 4:30 p.m. and 7 p.m. daily. Paragraph 2 states, pursuant to Executive Order 20-91, a social gathering is not an essential activity. No group of greater than 10 is permitted to congregate on the beaches, regardless of whether that group is engaging in an essential activity. Paragraph 3 states, no commercial activity is allowed outside of hours that the beaches are reopened.
Yeah, and so that language exists for that clarification. I think were you kind of alluding to in the resolution state that what is permissible activities, walking, running, fishing,
Yeah.
no laying on the beach.
Well, and that's where I
no
was
chairs,
going.
beach chairs. I think no commercial activities already there, so at least the setups can't take place. But if you know,
I mean, I hate to get that in the weeds with all this and that detailed, but I know the county has done that, so have some of the other municipalities and counties, so I don't know if it's something we need to do or should do, and I'll leave that to our counsel and attorney to sort of guide.
Mr. Bowman, you have recommendations, please?
Yeah, if I could elaborate on that real quick. We're in a little bit different position here tonight than the county was yesterday, and indeed, Executive Order 111 and 112 were just promulgated as we were sitting here. From what we can tell, as I've been reading Executive Order 112, it appears that the Safer at Home EO is ineffective beginning May 4th. However, there are new guidelines in place, and it appears the governor is still requiring that people limit their personal interactions outside the home to the essential activities that are described in EO 91, which was the Safer at Home. So that would preempt anything this council did as far as opening beyond essential activities. I don't think we need to include language in the resolution to that effect because it would already be preempted, but I just want to make the council aware of that fact.
Yeah, and the governor in that EO lists the acceptable activities.
That's correct. That's correct. They're essentially walking, jogging, any sort of recreational type activities.
Is this resolution going to open city parks?
Only beachfront parks. Lance has discretion on the opening of regular city parks, or council could direct the city manager in that regard.
We can do that as a separate action. I think we should do it as a separate action. Do you agree, city manager?
I think we could include the beachfront parks in this, and then the other park amenities that we have shut down, I could reopen them as the trend goes in the direction we want it to go in.
Yeah, we could probably come up with a consensus on the Bayside stuff, right? Do you think?
Yeah, do we have an actual order or a date on like the playgrounds, or was that more of, okay, so maybe that's something we could discuss at our meeting on the 4th?
Yeah,
what does
we could.
council think?
We're going to meet on the 4th? Oh, yeah, regular meeting. So I would just mention, our city parks, especially Calhoun, they're larger than our beach accesses, than our public beach parks. So logically, it would make sense to.
And we can, by consensus, allow our city manager to open those back up without an ordinance, correct, Mr. Bowman?
That's correct. That falls under the city manager's discretion right now, but of course, the council could direct the city manager to act in a certain manner.
Okay, and I think that's probably, we'll take that issue up after we get done. We do have a motion and a second here, and we're...
Mr. Mayor, can I just ask a question?
Yeah, I'll get to you just 1 second. I've got Mr. Marler, I got Mr. Braden, and now I got Skip. And after these three speak, I'd like to go ahead and take a vote on that motion. Were you queued up? You're good. Okay,
Mayor,
go ahead.
Mayor, I do want to remind council again that we do need some clarification on that motion as to the particular language that we want to see in the resolution.
So we need a amendment to the motion.
Some clarification would be good.
Okay, well, I'll tell you what. Skip, can you just wait 1 second? Or go ahead and say what you have to say, Skip. Go ahead.
Well, I was just going to, I guess I'm not clear on what we're trying to say here, what we are going to allow. Are we going to allow the beach vendors to go down there and set up chairs or not? And, oh, by the way, nobody's talked about lifeguards yet. I know the fire department's probably not there tonight, but is the fire department ready to give us lifeguards? And if we don't allow the vendors to put up chairs down there, are we going to allow private citizens or whoever goes down there to bring their own chairs and sit down there?
So right now, the ordinance states that no commercial activity is allowed outside of hours that the beaches are reopened. So if you simply remove the language on the hours, you would effectively be allowing commercial activity anytime the beaches are open. So if you don't want that outcome, we also need that language changed.
Well, but it says no commercial activity allowed outside the hours the beaches are open, which means that when the beaches are open, commercial activity is allowed then, correct?
That's exactly right.
Okay, so that means they can set up, the vendors can set up the chairs and everybody can sit down there and do whatever they wanted, swim, walk, run, jog.
And this is with the caveat that EO 112 that was just promulgated may preempt the council from being able to allow those types of activities anyway. We haven't had a chance to fully digest that new executive order, which was promulgated during this meeting. So.
And do you understand that, Skip? So even though our ordinance would allow it, the governor's EO at the present time would disallow it. And of course, that preempts our ordinance. Once he stopped that, then it would, our beach vendors could be setting up on the beach. And they're small businessmen too. So I would hope that they would have an opportunity to go back to work as well. So
I'm getting all sorts of messages that now the governor's extended 112 even further. Can any of our attorneys?
So 112 doesn't have an ending date. It just kicks in on May 4th, and then it says it doesn't expire until further order by the governor.
Okay, so it doesn't even begin until the 4th.
Right. The safer at home order and the short-term rental order were extended to May 4th, and then this new 112 takes over from there and controls after May 4th.
So for sure, short-term rentals will continue to be banned past November, past May 4th, correct?
Yeah, for sure. 20-112 now starts on May 4th and continues the extension on the suspension indefinitely. Until that order is no longer in effect.
And there's no
no
buzz
date.
on when that might be?
Not that we are currently aware of.
Okay, thank you.
All right, so are you good where we're at? Because the motion is different than the resolution. The resolution had 2 hours in the morning, 2 hours in the afternoon. The motion is wide open beaches. And then we have the issue within the resolution that states that the commercial operations could take place while our beaches are open from dawn to dusk. Unfortunately for them, the governor has circumvented that with his executive orders. Everybody got that clear up to this point?
I think it might be useful if council could include some language in the motion that would direct us to include language saying that the resolution 2020-09 is not intended to supersede Executive Order 112 and the list of essential activities that are contained therein.
Can we just say those changes so noted and get approval from the gentleman who made the motion initially, if that's okay?
Yeah, if Ray understands what we're saying, that'd be good.
You good with that, Ray?
Yes, but I do have a clarification on the motion.
Well, I know, but I wanted to make sure that Ray was taking the notes, so I want him to make sure he's up to speed, and then we'll look to Mr. Braden to approve or disapprove or to make any other changes he'd like on his motion. He may not want to change his motion, but go
Just
ahead.
one quick question. Would the motion be to approve the resolution with the following changes?
That's correct, Ray.
Because there's a lot more in that resolution than the beaches, so.
That's correct. There is some other sections to the resolution that we might want to go over before council votes as well, but let's get through the beaches first.
Correct. Okay, Mr. Braden, you're back on the floor here. Are you okay with those changes?
Well,
to
with
your original
those
motion?
changes, do they allow beach vendors or do they not?
That's not specifically addressed in the executive order. To the extent the vending would allow, if the vending would be consistent with the recreational activities that are allowed, then I guess the vending would be allowed. I'm not sure that your traditional beach chair setup would or would not be allowed. Perhaps Ms. Kopp would like to opine on that
But
issue.
like the paddleboard rentals or the Sea-Doo rentals or,
That's what I was getting at. I think those would probably be allowed under the executive order, but I don't think that chairs probably would be. But again, we haven't really had a chance to fully even read this executive order yet, so it's hard to advise you.
should we take a little break and allow the attorneys to read through that? And, I mean, I hate to prolong anything, but if there's something they need to really, I'm seeing, but I mean, if we're making some judgments and motions based on the wording of this new EO, then I think our attorneys need to make sure they're aware of all the ins and outs of it before we make something that we might have to change.
I think Mr. Bowman kind of covered us there, though, as long as the verb, the motion that Rodney, the recommendation changes if Rodney can accept them, because it is pursuant to the executive order by the governor. In other words, we can go ahead and open our beaches, allow for commercial activity when the beaches are open, but if some of that commercial activity is covered in the EO, then that's going to take precedence. So I think we're good.
Well, are we good attorneys, or would y'all like a few minutes to read and absorb?
I'll acquiesce to you. The traditional attorney meeting of the minds.
I think we're good. I think with that motion, if it incorporated that language, that would take care of it. And then we are also meeting again Monday, so we could take care of any issues on Monday as well.
And this also, we still, if we open our beaches, we still do not allow groups of more than 10.
Yeah, that's part of the new executive order as well, is local agencies are charged with not allowing groups of more than 10. So that would need to particularly be in the resolution, and it is currently.
So it's up to you.
Yeah, I agree with the motion and the...
Okay.
The
And how about the
second
second? We do. I've got two people queued up. Rodney, you're good? Okay, then Mr. Marler, and after that, if it pleases the council, I think it's time for a vote. Go ahead, Mr. Marler.
Okay, when you said the vendors, some of the condos, as part of their, I guess, the amenities are included in in their rent as far as chairs and things like that? How would that work?
I don't think that's really something this council probably has the purview to change, so I don't know, that's for your consideration.
It's still the same situation. That may be what the private property owners want to do, but still the governor's going to have to, he's got that in his emergency order, what is approvable activities, so that's going to take precedence over any action we do anyways.
And the other thing I had was more of a comment. Mr. Mitchell mentioned it earlier. At the urging of several citizens who called me over the weekend, I took a little trip, as I said, and watched the traffic jam at Noriega Point and also at Crab Island with our locals. And I had to drive across the bridge, of course, to turn around and come back through to Destin. And it's amazing that the Air Force's property, I mean, they had it all blocked off, do not park, do not enter. And I must have seen dozens of people just in my U-turn to go back over the bridge, walk right through it. So again, it's back to, if our locals aren't going to follow the rules, how can we expect anybody else to follow the rules?
Well, I'm glad to see that our locals are renting pontoon boats out of the harbor, because that was majority on Crab Island.
Well, you can tell Saturday everybody's ready to get outside. That's for sure. All right, we've had a motion. We have a second, but before we vote, I'm going to have our clerk read that motion out loud so everybody's clear before I take a roll call vote. Ray?
I just want to clarify. The motion is to open up the beaches from dawn to dusk, and then there's a caveat that this approval of this resolution is not intended to override the governor's executive order. Is that the caveat?
That's correct.
Thank you.
Okay.
All right. I'm going to take a roll call vote. We'll start down here with Mr. Braden.
Yes.
Ms. Ramswell.
Yes.
Mr. Menchel.
Yes.
Mr. Oberdeer.
Yes.
Mr. Marlar. Yes. Mr. Destin.
Yes.
Mr. Morgan.
Yes.
The vote is unanimous, so moved. All right, go ahead, Mr. Destin.
I'd like to walk on a motion. I know that will require a super majority because it's unagended, but there is a practical reality to inviting tourism back, and that will be, there will be shortages because they do pick over the grocery stores that we have when we do not have supply issues, which we do have. So it is my suggestion that we move to instruct the mayor, as we did at the beginning of this crisis, to encourage and recommend to all of our local grocery stores and pharmacies to continue holding the hours that they've set for seniors and vulnerable citizens. And I'd ask that they allow those hours to continue until we get through phase 3 of our process of reopening the state of Florida, and that would be at the expiration of the phase 3 order issued by Governor DeSantis.
If that's a motion, I'll second it.
I'm going to take that as a motion, and we have a second. Any discussion? I think it's a tremendous idea. Seeing no
Mayor.
Go ahead, sir.
I was going to bring this up later on, but I don't know if we need to include it in the motion, but something that we need to do from a PR standpoint is advertise, again, as you said, tourism's going to come. Somehow we need to put on our website, we need to coordinate with the TDD to really educate people to bring supplies when they come.
I think it's a great idea, Mr. Mitchell, and that's something that Catherine and I can work at, doing some video PSAs. In fact, I think it'd be a good opportunity for all our council members to get with Catherine, and that way we can run them a different face every single day, and that just be a continual message coming from our council, from the city manager's position. And I'll work with Jennifer and Mr. Destin, who sits on the TDD board. We'll make that a priority, part of the messaging, and I'm sure the county commissioners will be real encouraging in that aspect as well. So we do have a motion, we have a second, and I'll just start with you, Mr. Braden.
Yes.
Ms. Ramswell.
Yes.
Mr. Menchel.
Yes.
Mr. Overdeer.
Yes.
Mr. Marlar. Yes. Mr. Destin.
Yes.
Mr. Morgan.
Yes.
Vote is unanimous, so moved. Council members, do you want to give direction to our city manager about our Bayside parks with nodding of the head or a consensus, or do you have any questions, sir, that you'd like?
Just so you all know, We did not close any of the Bayside parks. We just closed the playground amenities in Clement Taylor Park. I think that's on the Bayside. That's the only amenity that we closed. So the park itself is still open to the public for passive recreation in the beach area.
And what about Morgan Sports Center and the playground there?
That is still, the playground is still closed. We have not resumed sporting events at the facility yet. That is part of the president's plan, and I don't believe we're quite there yet. So if you could give us a little bit more time to let that plan fall in place, I think we can.
I have seen folks with their kids or maybe the neighbors' kids, 5, 6 people wanting to get out on the ball fields and, hit a ball and catch one and stuff like that. So I would hope that hopefully within the next, maybe after our next council meeting, we could bring that up and maybe not start our organized sports programs, but at least open it up, our fields up to use by our citizens in a safe and reasonable manner.
Yeah, I would, on May 4th, if we could have an honest discussion about opening city parks that are closed, because if
Absolutely, I agree.
if we're going to take a step to, and we don't have to do
We
it
get that on the agenda? Everybody would like to see that on the
If we're
agenda?
going to take a step that's going to reopen tourism, I think we should reopen our parks for our locals. And then, again, we can just reevaluate it if things don't go well. And playgrounds, let's have that discussion. I'm not going to pretend that I have the answer to that.
Okay, what I'd like to do at this point, if there's no other business, we've pretty much done what's on our agenda. I would like to open up an opportunity for the public to weigh in or share their thoughts one more time. That's what we normally do. So, Matt, I'll look to you after anyone here in the room decides to talk, and then Ray, if you have any questions or comments. Marcy, you stood up first, so come on up first.
Mayor, I have one thing I want to add after public comment. Please.
Yes, sir.
Thank you.
Go ahead, ma'am.
Marcy Bell, 3 Gulf Breeze Court. Somebody reminded me that no one's wiped this thing off with Clorox, so I'm not going to touch it. I got a message on that. But anyways, I just wanted to say that I don't know how aware you are of it. I've tried to bring it up on my blog. Short-term rentals are renting. They're not even allowed to do that right now. What are we going to do about that? I mean, I've been sitting in the back room and listening to the conversation, and quite honestly, I'm sitting here in the room and I'm really confused on what just happened. You guys just talked about an order that came down from the governor in the middle of your meeting, and then you turned around and voted, I don't even know what. But when you talk about, I mean, that's how confusing it is, and I can't even imagine how confusing it might be for the people that are out there, or for the reports that they're going to read in the media that are going to say, well, they voted to open them, but it all depends on what the governor says. It's a real, the message that you just sent to the public is very confusing, and I'm going to be frank with you. Short-term rentals are not following the governor's orders. Councilman Marler spoke about Noriega Point. There were pictures from the beach over on the East Pass. I have no idea what was going on out on the Gulf. It was a confusing message, and I'm not pointing fingers at any of you, and I'm not wanting to be in your position, but for the person who sits out here as a citizen who participates all the time, that was real confusing. I just thought I'd bring it up. Thanks.
Thank you, Ms. Bell. And for the public record, we just voted to open the beaches from daylight to dusk. Just starting
Friday.
Starting Friday, May 1st. That's what we just did. All right, Bill.
I just wanted to say thank you for starting the city back to progressing so that the people that live here might be able to afford some food, might be able to pay their bills, might be able to pay their rent. I believe that you have to start somewhere, and I think with what you all did tonight, it's going to help lots and lots of people. So I'm going to say thank you to you all for doing that, and especially the people that are somewhere else. But also I want to mention that I know a bunch of short-term rentals, and a whole bunch of them are not renting, okay? But they do have family that's using the house. I don't think you can keep a property owner from having their family use a house. But anyway, And the other thing was mentioned was cleaning. Every short-term rental that I've talked to has mentioned to me the fact that their cleaning people do a far better job than Days Inn. And that's a given. I talked to a guy that owns 2 houses down in Seaside today. He just ordered a bunch of chemicals to send to his 2 houses. So the cleaning people, you know, with the bacteria and the wipes and all that, so they just would stock them there. So those people are trying to be the right thing. And I'm pretty sure that everywhere we go in this country right now, they're talking about social distancing. So it's not a new surprise from somebody from Tulsa, Oklahoma, trust me. I think they're all doing the same thing.
Thank you, Bill. And just for the public record, you can use 5 ounces of bleach to a gallon of water. It's one of the most effective disinfectant sanitizing liquids on the face of the earth. So, and there is plenty of bleach to be had in any store ever.
I never thought I'd be so excited to see Clorox wipes in the store, and they're still not there.
So just an FYI for all our short-term rental folks, if you can't get a desanitizer, use bleach and water. Anyone else tonight? Sir, come on.
Thank you. I just have one more statement, and first, thank you for your vote. I appreciate that very much as a private citizen of Destin living on the beach. Be able to get out and use it again. Also, I fully understood everything that was going on and do appreciate that. I was the one that made the comment about the sunshine, and I did do a fact check a while ago. That was done by a study by the University of Connecticut by their scientists in a controlled environmental study of closed spaces versus open spaces with natural sunlight. And it does inhibit the growth and the spread. So that's just a thing somebody throw out there. I don't usually throw something out in a public forum that I can't back up. And the other thing about the tourists coming back, I do serve on the board of the HOA where I'm at. I'm not here representing them tonight. I'm here as a citizen. But we meet every week, go over the numbers. We looked at all the people that are, that have canceled months out, and they're not just going to rush back. Number one, a lot of people are cautious about coming back. They don't want to get on airplanes. They're worried about going through public places and everything getting here. So that's one thing that's going to hold some people up. The other thing is a lot of the people that we rent to, we don't just rent to spring breakers and lawyers and doctors. It's middle America people, blue collar people. A lot of those people work in factories or places that support factories. I came from a large factory of 10,000 people, and our surrounding community that supported that factory was another 35,000, and then that trickles down into your hairdressers and your realtors and everybody else. Those have been shut down for 6 weeks across the country. So there's a lot of people, other than just the servers and everybody else, that are struggling because they don't typically put back a lot of money. There are a lot of paycheck to paycheck people. I don't see them rushing out to fly to Florida for vacation. So like the president said, hopefully we'll have a good, strong fourth quarter. Fourth quarter is the end of our season. So when we turn that switch on, it's still going to be a trickle for a little while, I believe. And I just wanted to get that out there for people that may be listening. And thank you again, and I appreciate your vote.
Thanks, sir. Bill, when you're listing all those great things, you forgot about people who finally be able to pay their taxes. All right, just want to add that. Oh, we know that. Our accounting department, finance department knows that. Matt, do you have anyone that, okay, go ahead.
We have Ken Wampler.
Mr. Wampler.
You can go now. There you go.
Hey, Mayor, how are you, sir?
Doing wonderful.
Good, council members. Hey, I just wanted to speak up relative to a couple things I've heard tonight. Clearly, I think opening the beaches is the right direction to go in. There's going to be a challenge relative to Captain Nix and how the Okaloosa County Sheriff's Department police is on the the east end of Okaloosa County in the city of Destin, but I'm sure he's capable of dealing with that. The other thing I wanted to address is the fact that the sanitation supplies, once the tourists left, we had a harder time finding sanitation supplies than when the tourists were here, because as you can recall, it was the middle weeks of March where there was the tourists were still here, but yet in the shopping centers and the stores and stuff, the supplies were minimal. So ironically enough, it's more of the locals that sucked up all the supplies. Now, that doesn't mean when the tourists get back that won't still be a challenge, but I think a lot of us, as Governor DeSantis said in his press conference, there was a fear over facts. And as he said, let's turn to the scorecard. And the scorecard says that there's a lot of fear and there's a lot of reality in it, but as it relates to the panhandle of Florida, we've done a fantastic job of staying home, taking care of each other. And I think that from a vacation rental standpoint, the city of Destin and the employees of Destin that work in the hospitality industry need to speak up, because it doesn't make sense. As one person alluded to, the hotels, motels, and inns are allowed to operate, and clearly the common area that's shared in the hotels, motels, and inn industry is a lot more than a single-family home that resides in Crystal Beach that obviously has a private pool, a private beach, and it just baffles me to no end the fact that Governor DeSantis would delineate between the two: short-term vacation rental, hotel, motels, and inns, and hopefully tomorrow TDC and the partners are going to have a call with Jimmy Petronas and Mel Ponder, and hopefully we can find out kind of where this is going, because clearly to extend the ban on short-term vacation rentals through May 4th is discouraging, understandable, but if it goes beyond that, I'm just at my wits' ends as to why the businesses in the Destin and Okaloosa County would even open up, because the majority of the clients that come here use short-term vacation rentals. They don't use hotels, motels, and inns, and that's my 2 cents worth. Thank you, sir.
Thank you. Appreciate it. Matt?
Got Lisa Rimkus.
Lisa, are you on?
Go ahead, Lisa. Can you click your microphone, please?
Hi, are you there?
Yes.
Yep, you're on.
Yes, hi. I'm here still from St. Louis, and I just wanted to say thank you for all the information that you have provided. It really does mean a lot from out of town, and I hope you all are staying safe. However, I encourage that you guys provide information to out-of-towners to make sure they come prepared. Bring Lysol, bring Clorox, bring paper towels, bring toilet paper, whatever it is that will accompany our needs and make our vacation just that much better. However, your businesses are going to be opening up soon, and they depend on us as tourists. How are you bringing in product? I mean, that's coming from other places too, so it's kind of a scare, as well as these tourists that are coming in. You want to open up your businesses, but at the same time, you got truckloads of product being brought into these businesses.
Yes, ma'am. Is that all?
Yeah, and I want to thank you for the information, and I am grateful for your vote, and I hope to look forward to being there in Destin in the next couple weeks.
Stay well and drive safe. Thank you. Matt?
We've got Christy Metello.
Christy Metello, are you on?
Yes, I am. Thank you. I'm also from out of town, scheduled to come down on May 16th from northern part of Illinois. I'm a little confused about the short-term rental rule. Is that just through May 4th at this point, or did you say that was extended?
Right now, it is still a ban indefinitely, and that will be up to the governor, Governor DeSantis. So probably YouTube his daily briefings. As soon as we get definitive word, we will post that high and low on our city websites. I'm sure our TDD will make that very well known with their websites. As far as the STR band, we'll just be in wait mode. That's not our. I don't think we have the authority to circumvent that at this time. So,
Sure.
so we'll make sure that the general public is fully aware of the situation when it comes to short-term rentals. Hotels, motels, those type of resorts, they're all available for rent, so.
Okay, yeah, I wasn't aware of that order when I booked it a few weeks ago, and it actually on the website, the VRBO website, it looked like I could have rented in April, so I was just a little confused when I heard that.
Maybe our code enforcement needs to start taking a look at those VRBO listings.
Yeah.
So anyways, I wish I had a more definitive answer for you other than just stay tuned.
Okay, thank you.
All right, thank you very much. Matt, anyone else?
We have Stephen Kepner.
Stephen, you're on.
Yes, I just want to thank you all. We had a great discussion. I think you're making the right decision. I know earlier I said something about coordinating with Okaloosa County, but I think I just didn't know enough about what that really meant, and I agree with what you're doing. I have to admit I'm a little more concerned about grocery supplies, but I appreciate you asking the stores to keep their special hours for us old folks. That should help a lot. And from a rental standpoint, just another side comment, I know the ones I'm familiar with are not renting short-term. They know what the governor has passed, so I think we're okay there. But I think you made the right decision, and I appreciate being able to listen to your discussion.
Thank you very much. Matt, is that all? Or do you have any more?
We have Phil Accardi.
Phil, you're on. I feel like a talk show host.
Thank you. I'd just like to thank you all for your common sense approach to the opening the beaches. I would also like to add that our condo complex of 198 units are not renting short-term rentals and are abiding by the governor's order. So again, thank you a lot. Thanks a lot.
Thank you very much for your comments. Matt?
That's all.
All right, Ray, do you have any other emails or any comments or questions from online?
I have a few, Mayor. Okay. First one is from Tori Wise from Chickasha, Oklahoma. We visit Destin at least 21 days every year, and we appreciate your efforts to get back to normal as soon as possible. Thank you.
Thank you, Ray. Is that it?
I got a few more, sir.
Go ahead. Just knock them all out.
This one is from Lucille Rogers from Destin. Councilman Braden said that if the beaches are not following social distancing, we could have a meeting to close them. Who will monitor the beaches? Because I've been on the beaches and have seen people with dogs and drinks and bottles. Signs are being ignored. Also, what is considered personal services? Will dental hygienists, massage therapists, estheticians be required to go back to work if they do not feel comfortable? This question is for Officer Maddox since he is reading from the governor's list of opening guidelines. We need further information on other businesses other than retail and restaurants.
Well, that's really out of our authoritative preview, so.
But you know what, though? I think that's a good point, because we've received a lot of questions about some specifics. Catherine, is there any way you could put some sort of FAQ together that addresses these types of questions? And I know we're getting more than just the ones we've gotten tonight, because people don't know, and they don't know who to ask and where to go to get the information. So let's give it to them.
Actually, the tourist development, they've actually put together a really great document with frequently asked questions, and we have been sharing that information.
Fantastic.
So I can absolutely just keep sharing it, so it's getting pushed out and the message is consistent.
Excellent. Is it on the website for people to be able to download? Or Facebook?
I'm trying to remember. I know it was on Facebook, but if it's not on the website, I'll make sure it's on there.
That'd be terrific. Thank you.
Absolutely.
Yeah, with your little social media app too, Catherine, get it punch out about 2 times a day, probably. You know how that works.
Yeah.
Thank you. All right. Is that it?
Mayor, I have 3 more.
All right, well, go. Don't stop.
This one is from, just a second. Drew Fenton from Palm Springs, California. My father and I own 3 short-term vacation rentals in Destin. We depend on the income from my dad's care in a veteran's home and for my and my son's living expenses in college. All of our rentals have no common spaces, so visitors could easily be safe with social distancing and other measures. Opening the beaches would allow even more social distancing and the opportunity for exercise. We would encourage the council to open the beach as soon as possible.
Go ahead.
This one is from Kathy Webb. I have plans to bring my 7 family members to Destin on June 6th and stay in a condo rental. I am 68 years old, if that matters. Will there be unlimited access to restaurants as we are not planning to cook while on vacation? Will stores, shops be open? What assurance is there that the condo rental will be sanitized? We will be coming from St. Charles County, a county next to St. Louis City/county. So is there an order in place where you do not want visitors from an area that has higher COVID-19 numbers than Destin? Are there any limitations you can share that I have not addressed above?
Those come from the governor.
Same thing. That's under the preview of the Governor DeSantis. That's not in our wheelhouse. I hate to pass all this responsibility on to the guy, but he is the governor. Go ahead, Ray.
2 more, sir. Regarding Crystal Beach area specifically, will we be able to bring chairs to the beach? Are there any activities excluded from the ruling?
Go ahead and answer that.
Could you repeat that question, Ray?
Regarding Crystal Beach area specifically, will we be able to bring chairs to the beach? Are there any activities excluded from the ruling?
That depends on the interpretation of Executive Order 112, which I don't think we've had a chance to fully digest at this point, but was incorporated into this resolution. So.
And not only that, but because of all the questions and information gaps, we'll go above and beyond with our public relations and information process on our city website and through the TDD to make sure that we can answer everyone's questions, but more importantly, make it easy for them to find those answers. So that'll be a focus with the city. Go ahead. That's it. And
Can we just clarify, because I'm actually getting...
I was just going to go ahead right on down through the line like we normally do, okay? Mr. Braden, you can start.
The last thing I wanted to say was I hope everyone gets on social media or and spreads the word, you know, as much as possible. You know, the beaches are open, but you know, please continue the social distancing, and hopefully we can encourage the vacation rental companies, the larger ones, to let their people know to, you know, bring as many of their supplies as they can, especially the meats and things like that, with them when they come. So hopefully we don't have to, you know, in 2, 3, 4 weeks start backpedaling and closing things down again. So hopefully everybody will get on social media and pass that word along. That's all I have, Mayor. Thank you.
Go ahead, Ms. Ramswell.
So I'm getting texts, and even my husband's getting texts, so he's texting me, that there's confusion out there about what's different between May 1st and May 4th. So my understanding, and so we can clarify it for everyone, May 1st, we're opening our beaches. That's the only thing different until May 4th, right? And then on May 4th, everything is still essentially going to remain the same unless the governor issues something else, correct?
Yeah, as far as the city's actions, the city has opened beaches as of May 1st from dusk to dawn.
That's the difference right now.
But as far as the executive orders, what the governor did in Executive Order 111 is he extended his Safer at Home order, which was 2091, to May 4th. And then what he did in Executive Order 112, from what we can tell, is he extended most of the terms of the Safer at Home order, but he relaxed them somewhat. I'm sure that there will be much debate over the extent of that relaxation. And what your resolution that you just adopted did is it incorporated those allowed activities into your resolution so that you would not be in conflict with the governor's orders, which you cannot be.
Okay, excellent. And I'm sure more will come out publicly and be released all over the place once this hits the news and people start talking about it.
Just want to assure everybody that the governor created this confusion, not the Destin City Council. We know what we're doing and we know what we did. The fact is, on May 4th, the governor is beginning to operate Florida in phase 1, and there's a lot of ambiance in different aspects to his initiating phase 1, and that's just, the news media will carry that information forward. We're going to stay pat to share information on what we have done here and do what Mr. Braden said, is make sure our visitors are educated on how to be good visitors and how to support our community, not only with their vacation spending, but also with social distancing, bringing supplies, critical supplies and stuff like that, so we all can get back at this in a safe and healthy manner. Mr. Mitchell?
Okay, thank you, Mayor. Just to kind of reinforce this, I've been getting text messages as well. There's still a lot of questions that are asked, and you spoke to this a few minutes ago, Mayor. I would just ask our city attorney, as soon as he can, to review these executive orders and let our public information manager put out a press release to make it real clear. This is what we're doing. These are the activities that you can and can't do. One of the biggest misconceptions that everybody still has is that we shut down short-term rentals. We did this. The only thing the Destin City Council did was close the beaches, period. Okay, so I think it's very important. There was a lot of things that we discussed tonight, and I just think, to echo what you said, we need to get it out to the public as soon as feasible after the lawyers review the information.
I agree with you, Mr. Mitchell, and Catherine and I will both make sure that that's done in a public service announcement, and hopefully for our councils that she could put that information in a position where we could copy and paste it and share with every single person that emails or texts us, so we don't have to keep typing.
Well, as we all know, we've received, I don't know, 100 emails or more, and right. So that would be useful. But the big thing that we're getting is just to make sure we clarify the activities that are allowed. And that's all I have tonight, Mayor. Thank you.
Thank you, Mr. Mitchell. Mr. Overdeer?
You clarify the activities that are allowed, I think was his question.
Let's do that right now, or do you want us to do it with Catherine and do that in the morning sometime?
Yeah, I think he wanted you guys to go ahead and put that together.
Well, no, yeah, exactly. The city manager said a little ago, obviously, we're getting this as we're in this meeting. So I think it would be prudent for him to go back tonight, tomorrow morning, review this, and make an informed decision, and then put it out, because he hadn't had time to really digest this.
Okay, Kim and I will get with city staff in the morning, and we will try and come up with some sort of FAQ and send it out to, get it out on a press release, and also send it to council so you guys are aware what the new executive orders do.
Again, just emphasizing the activities that are and are not allowed. Thank you.
Thank you, Mr. Mitchell. Mr. Overdeer.
Yes, Mr. Mayor, I was just glad to see that the governor needed a haircut just as bad as I do. So, thank you. Good night.
Thank you, sir. Ms. Marler.
Okay, so short-term rentals are open-ended is right now, based upon what I'm understanding.
They're closed till further notice.
Closed till further notice.
Essentially, yes. That's what EO 112 does.
Okay.
Mr. Destin.
Nothing tonight, Mayor.
Mr. Morgan.
If we could just open a barber shop for 15 minutes tomorrow, I would greatly appreciate it.
Mr. Morgan, is that a motion?
I'll make it. I mean, at this point, screw the guy.
My hair hasn't been this long since I had a mullet, so I'm with you. It's time for a haircut. You're getting that flippy thing in the back just like me.
Yeah, you should see my rat tail. It looks like an alligator snapping turtle right now.
There we go. There we go. Mr. Bowman?
Nothing from me.
Ms. Kopp?
Nothing, thank you.
This meeting's adjourned.